Good morning, Nita, and it's great to have you this morning.
Good morning. Can you hear me?
Yes, loud and clear. I can hear you.
Okay. Am I the only one on?
No, so we have other people on the waiting list, but currently I'm admitting the speakers today. Now, then I'll join. I'll make the others join shortly. We have other three people, participants on the line.
Yeah, but I thought we were supposed to start at 9 because you know I have to go to work.
Yes, exactly. So hold on for us for a few minutes, and we're good to start. This is not going to be Ghana man time, not at all. Good morning and welcome to Baby and Mom Project. And I am Maabena here, and I'll be your technical assistant. We'll be starting shortly. We have moderator joining us. Just had a few technical challenges, but then she's here. We'll be starting very soon. Thank you so much for making up to this program. And we hope that whatever question you have, whatever goal you have, all will be answered at the end of each session. Kindly feel free to use the chat box if you have concerns, if you have questions. We'll be readily available to assist. This morning, we are going to have 4 speakers, and they will be speaking about various issues that were advertised on the flyer. This morning, we currently have Nita. Nita is one of our speakers, and Dr. Nita Menu Chima is a gynecologist, and she's a medical doctor with specialization of obstetrics and gynecology. Dr. Nita has worked to provide holistic sexual and reproductive services to women in Ghana and beyond, and this is driven by the need to further empower women. So Dr. Nita initiated an online educational series that provides practical healthcare advice on childbirth, obstetrics, and gynecology called Time with Dr. Nita. So it's a privilege that she's here, and she's a specialist, one, in obstetrics and gynecology, as I mentioned earlier. She's also a member of the College of Surgeons, that's Ghana and West Africa. Interestingly, she's the second vice president of the KSJI Ladies Auxiliary 782, and she has 10 years experience in practicing and an MPhil in public health. Our next speaker is Maabena, and she's a fitness coach. So also known as, let me put it this way, so Ben's Entry, also known as Maabena, is the lead coach for Fitvolution Limited in Ghana. Her work includes coaching women post-pregnancy weight gain, diastasis, recti rehabilitation, and post-injury or surgery-safe exercises, stress management. Bennis also likes to spend time on most heart-rate depression awareness on their social media pages and organizing community health walks yearly to mark the International Women's Day celebrations. And we all do every year. She's a member of the American College of Sports Medicine and the IDEA and Fitness Association. She's worked with DWTV, Al Jazeera, Vodafone Healthline TV series. She holds a BSc in sports and exercise science. Our next speaker, Dr. Audrey Frimpong Baafi, is a pediatrician at the Tema General Hospital. And primarily, she's responsible for the assessment, diagnosis, and treatment of the patient's physical and psychological health issues. And as a pediatrician, she cares for newborn babies, toddler, and the children as far as the needs of her patients and clients are concerned. Have you heard or had the NICU experience? Are you worried about your child's health? Do you have questions on your mind? She's on board to help you give some insightful information to help you as a parent, a caregiver, a concerned individual take care of your baby and children. So Dr. Audrey Frimpong Baafi, there for you. We have nutritionist Akosua, a state-registered nutritionist, and she's passionate about nutrition. And as a nutritionist, she takes care of patients and clients of all ages from preconception to the aged. She's also a public and private practitioner and does occasional freelance nutrition works. Now let's check her portfolio. She's a registered and licensed nutritionist, And also, she's a UNICEF and Ghana Health Service certified nutrition advocate. She's a member of the American Association of Public Health Practitioners, a resident nutritionist of CTTV, that's for the nutritionist segment on Breakfast Daily, and an occasional writer and for graphic communications of Ghana. So good morning, and thank you so much for making up for this meeting today. And we hope that all your questions, all your concerns that you have listed down, these experts will explain to you. So Akosua is on the line, and she's going to be our host for today. I am Abokra Nyorgia, your technical assistant. Kindly send me a message via the chat box. I'm using the name Nutritionist Akosua, and let me know how I can help so we get this meeting running successfully. Thank you so much, and we kickstart in a few minutes.
We thank you so much for being part of this. And we are committing everything into God's hands. We are starting off and hoping that His will be done at the end of the day. And so, Father, we thank you so much for a wonderful time like this. Be in our midst and help us today being the last day of the year. We thank you so far for how 2021 has been. COVID came, we are alive. Have your way in our midst, in the name of God the Father, in the name of God the Son, and in the name of God the Holy Spirit. I pray with thanksgiving. Amen. So we will start off by having our first speaker for the day, Dr. Nita. And Dr. Nita's profile has already been shared with our technical assistant. And so, Dr. Nita, we'll start off by having you talk to us. People, Dr. Nita, for you.
Okay. Hello everyone. Hello Akosua. You're all welcome to today's show. So I would first start off with the part about obstetrics and gynecology. Our topic today, we're going to talk about how to boost your fertility, and then how to help, or should I say, how to make it easier for a couple to get pregnant. And then we'll also make a few comments about when you get pregnant, the safe things to do to ensure that your pregnancy goes to full term. And then a line or two about when to resume sex after delivery. So I'll start by I'll share my screen so that it'll be easier to follow what I talk about. Okay, is my screen visible?
Yes, you are.
Okay, all right. So the topic is about what couples trying to get pregnant are supposed to know. First and foremost, there's something we call preconception care. It's the care that is given to a couple before they get pregnant. This is to ensure that the couple are able to achieve the maximum best in their pregnancy, and then also help the couple, especially the woman, experience a very wonderful or amazing pregnancy experience, carry on into the postpartum, which is the few weeks after about 6 weeks of delivery, and to also help to improve the psychological, emotional, and mental capacity and support of the woman and her caregivers or relatives or partner or whoever is with the woman. So it's essentially, that's what preconception care does. It's like before you get pregnant, a few things that you're supposed to know, but it encompasses pregnancy time and then after pregnancy as well, because you would need to be safe, or should I say healthy, for the subsequent pregnancies. The first thing that every woman of childbearing age who intends to get pregnant is supposed to know is that they are supposed to take folic acid supplements. But what folic acid does is that there's something we call neural tube defects. You know, from when a baby is starting to grow, it's the parts of the body that in like beginning forms, it's the spine is part of the early body parts that form. And folic acid has been shown to help to prevent any deformity in any part of the spine. So right from the head down to the back and then down to where the legs are. So what folic acid does is that in correct amounts, it's supposed to help to prevent any of these defects in any of the parts of the spine. So every woman is supposed to take folic acid. We have the 400 micrograms and then we have the 5 milligrams. Ideally, the 400 micrograms should be okay for women who are not folic acid deficient, but sometimes dietary abnormalities and stuff, because of that, quite a number of women have the folic acid deficiency. So it's advisable to take the folic acid supplements. The body will take what it needs and then does not store the rest. So it's advisable that everybody takes the folic acid supplements. And then we have smoking. If a woman is smoking, it's advisable that before she starts to get pregnant or before she starts the pregnancy journey, she's supposed to stop smoking. What the smoking does is that it affects the, should I say, the fallopian tubes. So ideally, when a woman lays an egg every month, we call something ovulation. When she lays an egg, the sperm is supposed to meet the egg at some point in time, and then they come down into the womb to form a baby. So smoking slows down the transport of this egg, which would come down. And because of that, it may affect when you can get pregnant or how you can get pregnant, and then it may predispose you to ectopic gestation. So it's advisable to stop smoking before you get pregnant. And then some people have medical conditions. They may have diabetes, hypertension, sickle cell, kidney disease. They may be obese, hepatitis B and C. They may have HIV, thyroid disease. Essentially, any disease that you have. The list is exhaustive. I'm not able to bring all the diseases here, but if you have any disease at all, you're supposed to see your medical doctor, either your gynecologist or obstetrician or your physician, and then discuss this disease that you have. Make sure you have it under control so that when you get pregnant, it doesn't worsen, or it doesn't, either the disease doesn't worsen or doesn't worsen the pregnancy condition for you. And then we have oral hygiene. You have to visit your dentist. In Ghana, generally, people don't visit their dentist. So it's advisable that before you get pregnant, you visit your dentist. You make sure that your oral hygiene is up to its best before. We have over-the-counter medications. A lot of women, because we don't go for preconception care, or because most pregnancies are not planned, as much as 50% of our pregnancies are not planned. So most women, by the time they realize that they are pregnant, they've probably gone beyond 6 weeks or 5 weeks, or sometimes even 8 weeks. And because they may not know this, some people tend to take all these medications, over-the-counter herbal medications, or just buy some medications, maybe for pain relief or for whatever reason. So before you try to get pregnant, you have to be wary of these medications. Sometimes they may cause some abnormalities in the baby that is developing, or may lead you to get miscarriages. So it's advisable that if you want to get pregnant, you talk to your doctor about any over-the-counter medication you are taking, so that if it will affect the pregnancy, you either stop it or you delay for some time before you get pregnant. Pesticides and fertilizers, paints, turpentine, all those things are known to have an adverse effect on pregnancy. Then you need to take a healthy diet rich in vitamin C, such as oranges, pineapples, pawpaws, mangoes, all the brightly colored fruits. They help a lot in preconception when you're trying to get pregnant. And then you're supposed to ensure a healthy BMI. So if you are obese, if you can lose some weight, it will help in the getting pregnant in the first place, and then also ensure that you don't gain too much weight in the pregnancy. We also have things to relieve you of stress. maybe a beach, maybe just some music, maybe having a nice time with friends. They are all supposed to help relax you, because the more stressed you are, the more difficult it is to get pregnant. You can also have some form of exercise. It can just be a leisure walk in your neighborhood. It can be a small jog. You can use your treadmill, just something to boost your immunity, to boost your physique, to help you to get pregnant as well. Then one important thing is your menstrual cycle. At the end of the day, with all other things involved, as a woman, you're supposed to know your menstrual cycle, know when you are most likely to be fertile and then when you are not fertile. Because for every cycle, for a normal menstrual cycle, there's just a small period within which you can get pregnant, the ovulation period for the woman. When the woman ovulates, or should I say lays an egg, within 12 to 24 hours, if that egg is not fertilized, that window is missed, and then she would have to wait for the next cycle. So you, the woman, you're supposed to know when your menstrual cycle is, when you're most likely to ovulate, and then you can increase your sexual activity around that time, so that your chances of your egg or ova getting fertilized is increased. We also have genetic counseling. Sometimes people have certain diseases that may be passed on, like sickle cell, cystic fibrosis. We have something we call G6PD. They're all blood defects that may be passed on from mother to baby or from father to baby. So it's advisable for the couple to see a doctor. They have this discussion to see the prospect of the transmission of this disease onto their child before they get pregnant. Then before that, you also have to make sure you have all your vaccinations and STI screens. Sometimes STIs can affect pregnancy, cause abortions and miscarriages. So you need to screen to be sure that you are safe. And then also we have the pap smear that the woman should be able to do. If you screen for hepatitis B and you are negative, then you would take the vaccination as well. We should bear in mind that for a couple to be able to get pregnant per cycle, there are certain things that may affect this couple's ability to get pregnant. And then fertility is not only one way, it's not only according to the woman or due to the woman. A third of factors affecting fertility are due to the woman, a third are due to the man, and then the other third is due to a combination of both the male and the female factors, and then other things that we cannot explain. So ways of boosting the male fertility, things that may have affected the male fertility. We have mumps. You know, when we're children, we used to call something T. They have this swollen joint, swelling jaw. Sometimes it's a viral infection that usually affects children under 6 years. But in very bad situations, it may affect the testicles. And when it does that, sometimes it affects the sperm count, the sperm quality later on in life. So we need to find out if the person has had mumps before. And we have chlamydia, we have gonorrhea, we have HIV, they may all affect the male fertility. Some diseases like cystic fibrosis, if the male has undescended testes, it may affect the ability of a male to impregnate a woman. And then some people who sue for some reason, maybe their job or whatever, exposes their scrotum to a lot of heat, it affects the quality of the sperms. So truck drivers, especially long distance drivers, people who wear very tight clothing as part of their work, it makes that area, the perineal area, very hot. So it affects the sperm's production and then the quality of the sperm. Sometimes we have medical conditions like hypertension, we have diabetes. All those ones affect the sperm quality, sometimes even the sperm count. Even these diseases, sometimes the drugs that are being used to treat them may affect the sperm quality as well. And then we have varicocele. It's a condition in which the blood vessels in the scrotum get enlarged, and because of that, it affects the quantity of sperms and then the quality of sperms that may come out. We have other things like pesticides, radiation, cancer and chemotherapy, cigarette smoking, alcohol, marijuana use, anabolic steroids, and then some drugs used to treat hypertension, depression, and then infections. They all affect the quality of the sperm. I just put a slide or two about how to boost male fertility. We have vitamin C. Vitamin C has been found to have a very high level of antioxidants. What these antioxidants do is to reduce the number of deformed cells. It protects the DNA damage that we have every day as you go about your activities. There are some oxidative stress that goes on in your body. So what the vitamin C does is to reduce the number of these damaged cells, and then improve the quantity or the quality of the sperms. It also prevents some heart diseases as well. We have vitamin C in oranges, we have it in lemons, we have it in pineapples, mangoes, the brightly colored fruits. They all contain a lot of vitamin C. So you can have a diet rich in that, or you can even take the vitamin C tablets, either the chewable ones or the one we put in water, the effervescent ones, and then every day you take it to boost your fertility. Yeah, vitamin B12 is found in meat, fish, and dairy. It protects the sperm from all the stress of the day. Then we have vitamin D. It also helps to boost the testosterone levels. We have ways of reducing stress. When you reduce stress, stress has naturally been found to affect, should I say, quality of sperms, the sperm production and all that. So we need to reduce your stress levels. You can have some time with family, you can go for exercise, you can have meditations, you can have movies, you can have dancing, anything just to relieve you of your stress. Like I said earlier, diets rich in fruits, vegetables, and then lean meat. The less the carbohydrates, the better. The man also has to maintain a healthy BMI, exercise regularly, eat a lot of meat, fish, eggs. They all help to boost the quality and the count of the sperms. Ideally, in our this busy world that we are in, people are trying to make a lot of money, so they are stressed out. They don't have enough sleep. Sometimes they have 4 hours of sleep, but ideally about 6 to 8 hours of sleep is good for any normal functioning adult, so that you get enough rest for your body to recover from all the stress of the day or of the year. Eat a lot of walnuts, cashew nuts, and then almonds. Alcohol intake should also be to the barest minimum. Some people cannot stay away from alcohol, but as much as possible, the barest minimum quantity of alcohol is necessary to improve, so that the shape, the count, the size of the sperm is not reduced. It also helps to improve testosterone levels. Alcohol has been found to reduce the levels of testosterone. Then the other aspects, apart from the physical things, are the sexual function of the man. You need an adequate level of libido to even engage in sexual intercourse. So things that may boost the libido, stress levels can reduce libido, medications can reduce libido, certain diseases can reduce libido. If there are any conflicts in the relationship, they all affect libido. So all these things would need to be sorted out. Then we have erectile dysfunction. That is the inability of the male sexual organ, the penis, to be able to be erect. And you know that we need an erect penis in order to engage in sexual activity. So if the person has a sexual dysfunction, like erectile dysfunction, they may need to see a specialist who will deal with it for them, so that they will be able to engage in sexual activity. You have certain injury to reproductive organs, maybe from accidents, from drugs, from anything. All these things would need to be sorted out in order to help the men to be able to engage in sexual activity. We have a few top antenatal tips for women. I said earlier, folic acid is very, very important in the preconception care, and then the first few months of pregnancy, up to about 5 months of pregnancy. Is very, very important that the woman takes it every day. And then you can also have some few exercises if it's not contraindicated. For some women, it's not advisable for them to have exercise. Like sometimes those who have bleeding in early pregnancy, those who have something we call placenta previa, when the placenta is coming before the baby, people who have issues with their cervix, sometimes they may not be allowed to engage in exercise. But if not, and you have a normal pregnancy without any complications, it's allowed to have a few exercise periods, maybe 20 minutes in a day or 30 minutes of mild exercise in order to boost your immunity, improve blood flow to your organs and stuff. And then you're supposed to have a birth plan. A birth plan is like from, let's say the latter part, let's say the 3rd trimester, you're supposed to make a plan with your midwife, with your doctor, with your partner, or that this hospital is where I want to deliver. If I go into labor, these are the things that, this is how I'm coming to the hospital, like my transport medium. I want to be in a separate labor ward. I want my partner to be there. I want my mother to be there. I want my partner to cut the cord. I don't want too many, let's say, too many people in my labor room. I want this kind of delivery position. I want to go to this hospital. If this hospital is not able to take care of me, there's a referral hospital they can take me to. I agree to this referral hospital. So it's like a total plan when you go into labor, essentially. I want maybe an epidural anesthesia. I want water birth. I want a spinal anesthesia. I want a cesarean section. It's all helps us to know exactly what we should do if you go into labor. And then if there are any complications, how we're going to go about these complications. And then we have the family planning options, either the short term or the long term, depending on the couple's fertility goals. So you discuss this with your doctor so that when you are done delivering, we know exactly which kind of family planning method you chose, and then we go ahead with that as well. You also need to educate yourself. You need to read as much as possible about the pregnancy, about every trimester, what is happening to your baby, to you, the minor complications of pregnancy. Can I solve it myself? Can I deal with it? Do I have to take it to the hospital? You need to educate yourself all the time, and then try not to be swayed by all other people or other things that are on like that try to talk to you. If you have any complications or any problems or any concerns, you need to speak to your health professional about it. You may need to change chores. Lifting heavy objects, you may need to stop. Certain amount of sweeping, you may need to stop. Carrying heavy objects, using certain chemicals to clean the house, like pesticides, detergents, bleach, and all those things. Painting, sometimes they are not good for the developing baby. So you may need to switch chores for somebody else to do the heavy duty ones while you do the lighter ones. You need to avoid harmful chemicals, over-the-counter drugs. In every pregnancy per woman, depending on how much weight you are starting with, there's a limit to how much weight you can gain in the pregnancy. You have to eat a lot of foods which are high in fiber. Some people have constipation in pregnancy. So if you are prone to these things, you need to take in a lot of fiber-containing foods to avoid constipation. You drink lots of water, you eat a lot of vegetables. Then your caffeine intake should be reduced about once or twice a week. No alcohol. Alcohol is a complete no-no in pregnancy. There's something we call fetal alcohol syndrome. It's found in people who drink. Their babies have certain deformities that may come when they have they take this alcohol. So alcohol is a complete no-no in pregnancy. No smoking. Cats have been found. Some cats have they are hosts of certain viruses that cause a disease we call toxoplasmosis, and it can cause certain birth defects. So if you have a cat that's not vaccinated, or you're not supposed to get close to unvaccinated cats, if you have any concerns or problems, either you call your doctor, your midwife, or you visit the hospital as soon as possible. You get enough sleep, you visit your dentist as well, like I said. If you are in a vehicle, you have to ensure that you are in your seat belt. You need to go to your birth facility to tour the place so that when you go into labor, you know exactly where to go. You need to make memories, take pictures of yourself, of your tummy. Sometimes you maybe need to take videos of your tummy. When you see the baby moving, you take videos of it, you make a scrapbook, you cherish the moments, because these moments come and then you may never get them again. So as much as possible, you need to create memories of it with your partner, with your mother, your father, your sister, anybody, friends, so that you have a very positive pregnancy experience. And you also need to enjoy your pregnancy. You have happy thoughts, you smile often, you enjoy the few moments you have with your baby, because believe you me, when you give birth, it's a whole marathon altogether. So you need to enjoy yourself as well. When can couples resume sex after delivery, be it CS or vaginal? It doesn't really matter when we cannot give a specific time that the couple should have sex, depending on your route of delivery. When you deliver vaginally, the area will be sore a little, and it takes time for the vagina to heal and to come back to its previous state, or as close as possible to pre-pregnancy state. So within that time that your body is getting back to its normal period, normal, should I say, state, we cannot give a specific time that, let it be 2 weeks or 3 weeks or 4 weeks. So long as the woman is comfortable, the couple can ideally have sex. As in the first 2 weeks, yes, because your cervix is still open, there's a risk of infections climbing up from your vagina into your uterus. So it's not advisable, but usually we don't give time, so that whenever the couple are okay, especially when the woman, she's comfortable enough to have the sex, then the couple can resume. Generally, women who have CS tend to have engaged in sexual activity earlier than women who have vaginally, and that's understandable, because for the CS, nothing happened down there, so it's a lot easier or less painful to engage in sexual activity. But we don't really have a specific time. So long as the woman is comfortable, we give the go ahead for them to resume their sexual activity. So I think I'm done for my presentation. Thank you very much. Over to you, Akosua.
Okay, thank you so much, Dr. Nita, for this awesome presentation. I believe that we've all learned a lot. If we have any questions from our participants, you can comfortably go ahead. Dr. Nita will be here to answer your questions in the next, let's say by 9:45, we should be done with Dr. Nita. So if you have any questions, the floor is open. You can unmute yourself and then go ahead with your question.
Okay.
So Kezia, Dr. Nita is here to answer your question. Aileen, Charity, Linda, Elsie, and everyone on board. If there are any questions for Dr. Nita, she's at our service. Kindly unmute yourself and then go ahead with your question. Okay, so I believe that we are all okay. You can also leave your questions
hello.
in there. Okay.
Good morning. This is Kezia.
Good morning, Kezia.
Please, I would want to know. I recently delivered less than a month ago, and I want to know if it's okay to still take my vitamins. I was taking Vita. Is it okay to still continue? When should I stop taking it?
Kezia, I didn't get your question. You said it was okay to.
I recently had a baby, like less than a month ago.
Okay.
And I want to know if it's okay to take my previtamins and folic acid. And if I should, how long should I take it? And how should I stop taking it?
Okay. So you can continue taking your vitamins. You can finish the stock that you have. Okay. And then as for the multivit, you can continue taking it till we don't really have a specific time that you can stop. But if your iron levels are low, when you deliver, you lose some amount of blood. So if your iron levels are low, you may need to take the iron tablets, or you may use the diet to raise your HB levels. Other than that, you can continue the multivit till whenever you want to stop. We don't really have a specific time that you can take it for. Have I answered your question, please?
Yes, please.
Okay.
You have.
Okay. All right.
Thank you.
Okay. You're welcome.
Okay, so do we have any more questions for Dr. Nita? Hello. Is there anyone here with questions for Dr. Nita? Okay. So I believe that Dr. Nita has answered the question on the mind of our only participant who decided to ask a question. So Dr. Nita, thank you so much for your time. I don't know if you have any closing remarks for us before we take a short break and have our second presentation from Dr. Baafi, who is a pediatrician.
Okay. Okay. Just a little summary of my presentation. Now, there's something we call preconception care, and that if a couple wants to get pregnant, they should be able to see their doctor to discuss their concerns, and then need to address any complications or any complications that may happen along the way or before the pregnancy. And then they should also ensure that they take their folic acid every day. That's my.
Okay, thank you so much, Dr. Nita. God bless you. We wish you the best as we all end the year. We pray that may the good Lord replenish everything you've lost for the sake of this program. And we ask that may He usher you into the new year in grand style. I know you have to go back to the hospital, so all the best. All the best for the day. See you in 2022.
Okay, all right.
So we'll move on to Dr. Baafi, who is a pediatrician.
Thank you, Akosua. So I would log off now.
No problem.
Okay. All right, yeah.
So Dr. Baafi, who is a pediatrician, will take over. So Dr. Baafi, please, we are ready for you.
Okay, good morning, everyone. Akosua, thank you so much for inviting me to meet these August people. I'm glad to be part of it. And let me get my slide and share. Oh. Good. Please, I hope everyone sees my slide. Is it clear enough?
Yes, you are. Very clear.
Okay. All right, thank you. As Akosua mentioned, my name is Dr. Audrey Frimpombe. I'm a pediatrician at Maabena. Today I'm going to have a chat with mothers. There are so many topics, but I just picked just a few for us to talk about. I did not go into details, so if just in case after the presentation, if there is any question to ask, you go ahead and feel free and ask. Okay. So I'll talk about common childhood illnesses, general care of the new babies if you have any, and some safety tips for children. So with children, we all know that quite a number of times they fall ill much more frequently than others, and it's all to do with their immunity. Their immunity is a bit low, and as they grow, they build up their immunity. So the more exposed they get to infections, the more they build up that immunity against that kind of infection. Someone will ask us, so the baby doesn't have immunity at all? Yes, he does have some immunity. That's why most of the time we encourage more of breastfeeding, because they get immune. What the mother has acquired, the child is able to acquire it as early as possible to begin to fight infections that happen around. Now, the very common ones that we normally see, we have a common cold, the sore throat, the ear infection, Gastroenteritis is just a big word, but it's nothing, but it's the diarrhea, vomiting, maybe abdominal cramps that goes with it. Mostly with children, their illnesses, majority of it is viral. Viral doesn't need antibiotics. Antibiotics for bacteria. So most of their illnesses, majority of them, it's viral. A few viral infections, yes, we treat, and that one will depend on the diagnosis the doctor makes. But as I said earlier, majority is viral. So the common cold is a viral infection. It goes on its own. And we don't need antibiotics. If the child is in school, I would advise that we'd rather keep the child at home. Because what kids normally do is, I always use the term, sharing is caring. So they'll see a friend, they'll give a hug, they'll touch toys. And when they are cleaning their nose, they just wrap their hands over their nose and go back, touch the toys. So when they are at school, they easily infect each other. So my advice always to parents, if your child is having a cough and cold, keep the child at home. I know it's very difficult for us corporate people working on our own. How do I take care of my child? But think about it. If someone else's child is sick, takes the child to school, then your child gets infected. It's not fair. So it's best you keep your child at home. Max 3 to 4 days, max 5 days, the child is fine. He goes back to school. What is important for that child is to make sure the child is well hydrated. Hydrated, taking a lot of fluids, water. Some kids don't like water, so you can give these fresh juice to them and they can take it. What is important is that they are well hydrated. If the nose is blocked, just instill the saline drops. The saline drops, I read some people, oh, I've used saline drops, that is not going. Please, saline drops is not medications to stop colds. No. What it does, that the mucus is so thick and it blocks their airway, so they have difficulty in breathing. So when you instill the saline drop, it just softens the mucus, breaks it down, and it runs freely so the child can breathe well. That's the essence of the nasal drop. When you realize the child is getting coughs, cold quite much more often, you can give vitamin C. The vitamin C does not stop the cold. What it does, it just builds the child's immunity. So someone, I'm giving you my child oranges or any form of citrus. It's great. Go ahead with it. The more the child takes it, it builds their immunity to fight infection. Now, sore throat can be viral, could be bacteria. So in most of the time, when they have it, if you realize the child is having a temperature, you give paracetamol to get the temperature down. But what's really important makes the child is more hydrated. I'm stressing on the hydration because sometimes the children come to the hospital and they are dehydrated. Getting a line for them and IV access for them is so difficult. And as usual, mother was, this doctor, this nurse keeps pricking my child. No, we don't want the child to get to that stage, because when we don't have that access, then they'll keep pricking until they get a vein, all in an attempt to save your child. So to prevent that, make sure your child is drinking well and is well hydrated. If the child is well hydrated, it keeps them alive. I always say that children are full of water. They are not like adults. We have our volume of water in our bodies is lower than children. Children are full of water. So once they get dehydrated, they are down. But if they are well hydrated, they are up and about and they are very playful. Some can be so sick, but you see them playing around, and it tells you how well the child is well nourished and takes in its fluids very well. Okay. So ear infections is the same. Ear infections could be viral, it could be bacteria. The bacteria comes in when you realize, okay, I've started my antibiotic. I've taken my I've given para for a while. I realize that this temperature is not going down. The child doesn't look too well. Then you send the child to the clinic. Then the doctor does a thorough exam to see. Based on what the doctor sees, then the person can predict and say, this one could be much more bacterial than viral, because viral has its own presentation and bacteria has its own presentation. With the bacteria, they are very, very ill. Viral, they are not that ill, depending on what is causing it. So it's the same, your analgesics. When I say analgesics, is your paracetamol or your brufen, whatever the child can take. Then, but I'll always advise brufen. If your child has allergies, I don't advise brufen. We don't give aspirin to children, so avoid that. Para is safe. Give your paracetamol. Para is the same as Tylenol. Is the Americans, they use the time term. Calpol is all para. So it's the main names is acetaminophen. That is the name we give to it. But depending on whether it's manufacturing gives a name. So some will say Panadol, others will say Tylenol, another person will say Calpol. They are all paracetamol. Okay. Then the gastroenteritis with kids, most, as I said, most of it, it's viral. So they may have a running tummy, and it's once it doesn't have a high grade temperature. When I use the term high grade, means that the body's temperature is very high. If it's extremely high and the stools, you're seeing blood, please report immediately. Don't manage at home. But if the child has maybe a slight temperature, child feels warm, running around, or go and pull one or two, just a loose stool, might be greenish, it might be normal brownish, just a loose stool. The child is eating well, doesn't complain, tossing and turning with abdominal cramps is so severe the child cannot handle. You can manage at home with ORS and zinc. Some ORS are flavored, so you can introduce it. If you realize the child is not taking the ORS, you can do coconut juice, coconut water. Just get some and give. I know some mothers will tell me, still the coconut water my child will not take. You can do some salt with sugar, but the sugar shouldn't be that much. Mix with water, and you can give that. Then the zinc tablet. The zinc tablet is very important. You'd give it 1 tablet a day. What the zinc tablet does is it shortens the duration of the diarrhea. And the gap between maybe a child gets diarrhea today and another time of the child getting diarrhea is further apart. Research has shown. So that's why now we insist ORS and zinc, because it helps the child. So make sure there are 3 things I always say, make sure, actually 4 things you should have at home. The thermometer to check temperature, your paracetamol, your ORS, and zinc. You should have it in stock. Do not have a pharmacy of antibiotics. Rather have these in stock as your emergencies. If the tummy still persists, the child is having a very high grade temperature, severe abdominal cramps, please, or the stools are watery with blood or mucus, whatever it is, please, you can bring the child to the nearest hospital as closer to you than if you have a particular hospital you go to, you can go. Now with feeding, this one is general care for new babies. Now, some of you may have already have your children, others you are just a first-time mother. I always encourage exclusive breastfeeding. I know we struggle initially, yes. The first 24 hours, if you're a new mother, you struggle with it. But the more the child sucks, that's when it tells the brain, it sends a signal, as the child sucks, it sends a signal to the brain that breast milk should be produced for this child. That's all it does. So the sucking stimulates the hormone that tells the brain to release another hormone for breast milk, for the milk to be produced. So if your child doesn't suck, no signal gets to the brain for it to quickly do that work for you. So now, if you realize that immediately you deliver, they put the child on you, within a few hours, you may even have a CS to bring your baby to you to start suckling. The more the child sucks, that's when you get your breast milk on time. Times is so difficult, but if your child sucks for that long, it will come. So we encourage breastfeeding. Some people are in a hurry, go and get formula. No, please. Do your breastfeeding. It's when you are not getting breast milk at all, and there's no sign of the child, your breast even getting engorged, then we intervene. But please work at getting your breastfeeding done. If you're not getting your breast milk at all, then we introduce the formula. So I'm not the kind as you're not getting breast milk, give formula when you have not gone through the process. If the child has suckled throughout and is not getting anything at all, that is when the formula can be given. But immediately the breast milk comes, please go back to the breast milk. I know some people are strong advocates for breast milk and nothing, but we have instances that you can't do anything about it. It's dry. Mother is not getting it. You can't keep the child on IV fluids, only waiting for the breast milk. That's one if you are in the hospital. But if you're in a place you just delivered vaginally, you are going home the next day. It's important you put the child to breast. But just in case you are discharged early and you're going home, you realize that you are not getting the breast milk, please report back to your clinic and let them advise you what to do. Now, with the breastfeeding, some mothers struggle with breastfeeding. The child needs to be well latched at the nipple. So if you give him breast milk, I always say we have table etiquette. And I use the term breastfeeding etiquette. So if your child is breastfeeding and you are hearing this, no, the child is not well latched at the nipple. So if your child is holding only your nipple, it will be sore. So when the child is breastfeeding, the child will automatically hold your nipple. Try and push the areola, that's the dark area around your nipple, into the mouth. Once you're able to get it, a lot of your breast into the mouth, that noise you hear would stop. Because if he or she does, they get a lot of gas into the tummy. Within the short time, the gas is out and they are crying. You said, I just fed this child. Why is this child crying? I've checked the diaper. The child is not wet. Why is this child disturbing me? It's because the child is hungry. The tummy was just 3/4 full of gas and 1/4 full of milk. So your child is hungry. But if the child is well latched, the child is able to suck in a lot of breast milk and the child gets full. Once the child is full, that child will rest for you also. Take a good rest. And that's important because if you are tired, you will not lactate. Your child will be frustrated and you will also be frustrated. So getting the child well latched at the breast, at the nipple is very, very important. Now after feed, sometimes you're in a hurry. After feeding, you're in a hurry to put your baby down. Please don't. It's a no. Make sure you burp your baby immediately after feed. Just cup your hand and pat the back. You hear a port sound, that's all. Don't be rubbing. The rubbing, some babies, if you rub, will never burp. So it's important you just cup and hit the back as hard as you can. Nothing will happen to your child's spine. Hit until your baby burps. At least, I always say the minimum should be twice, because that's when you are sure that the child gets enough of the gas out. If not, this child will stretch and be crying. So this stretching, my baby is stretching and being crying, stretching is gas. You realize the tummy is so distended, it's gas. And the only way to avoid it is to make sure the child is well fed. Or else the child will be lying down, burps, and the milk comes through the nose. And that's dangerous. Because if the child keeps doing that, the child will develop a pneumonia. And you end up back in the hospital. So let's try and prevent. Now, management of fever. In management of fever, I always say that fever is when the temperature is more than 37.5. That's why I said there are things you have to get at home, a thermometer. Because using your palm gives you a fair idea. But if the temperature is at 37, once you touch with your palm, the child will feel warm. You'll be in a hurry to go and give para when the child does not need paracetamol. Paracetamol comes in only when the temperature is more than 37.5. Remember, para is it's a medicine. It has side effects. It destroys liver. So please don't joke with it. I know some people keep giving children para, oh, feels warm, giving para. Please, you're destroying this child's liver. Get a thermometer and use. When you check it's more than 37.5, then you give your para. But if the child feels warm, 37.3, you are not comfortable. Just do tepid sponging. Tepid sponging means use lukewarm water, pour it on the child, and leave it to dry on this. As it dries, it takes the heat out, and the child will be fine. Now, when you are given para, depending on the age of your baby and the weight, normally it's 1.25. It also depends on the dose. That's why I'm given 1.25 ml to 2.5 ml, depending on the age of the child. And you give between 4 to 6 hours apart. That's Some does 4 times. Don't go beyond. Although we said 4 times, it means that's the extreme. But I've indicated that don't exceed 5 doses in 24 hours. Most of the time we say do 3 times, and that's the safest. But maybe you have times you have when children are still getting temperature, it's high in between. You've given few hours, you realize that the temperature is up. Just be patient and wait. It's best to do 4 times than doing it 6 times. Don't get there. That's the 4 hours. That's 6 times in 24 hours. So if you realize that I've given 4, I'm heading towards 5, straight move to the hospital or consult as early as possible. When it comes to the preterm, we are a bit careful because I said it goes through the liver. Your liver is not that matured. So that one discuss with a pediatrician or any senior doctor who can help. Jaundice. There's one thing that is always on my heart I want to talk about. It's very extensive, but I've just summarized it. We should know that babies get jaundice. So don't be scared. But 60% of 10 babies, that's when your time is due, and have jaundice. For preterms is higher because I said their liver is not well matured. Now, when the babies are in your womb, they are taking all their nutrients from you through the cord. And the nutrients is being carried in the blood, and you need your hemoglobin. So in the womb, their children, their hemoglobin levels are very high. Some can be even 21. So that's how high their hemoglobin levels can be. When they come out of the womb, that's the quantity of hemoglobin is not needed. So God in his wisdom starts doing it, what we say physiological. It starts breaking down naturally to the normal level as ours. So when it's breaking down and it's being converted in the blood, when the red blood cells being breaking down, then it breaks down to bilirubin. It's the bilirubin that gives the yellow stench. So we all have bilirubin in our bodies. The liver does the convention, but remember the kids, their liver is not as matured as ours. So converting it, they can't quickly do that. So some of it gets stained on the skin, some on the eyes. And that's where we get worried. If you have a fresh baby, male baby comes out less than 24 hours and your eyes are stained, as we call it pathological. He needs immediate investigation because there are other causes of jaundice. So we want to find out what is causing this thing to happen so early in less than 24 hours. Maybe there's something causing it. So when you bring the child to the hospital, the doctor will run some investigations to find out what is really causing it. They said that is to do with, because sometimes to do with the blood group, mother's blood group is not compatible with the child, or mother is rhesus negative, the child is positive, or that's why sometimes if you are a rhesus negative mother, doctor will say, get a shot of the anti-D. It's just to prevent this jaundice, your child having jaundice very quickly. Or maybe there is a GC speedy or something. Whatever it is, we need to investigate and find out what may have caused this child having jaundice that early. Normally, the physiological one is what I'm talking about. You see it from day 2 of life onwards. So that one, when you see it, that's why I encourage breastfeeding, because the early feeding helps to wash it out. It gets into their poo. They urinate it because they don't get dehydrated. The more dehydrated the child is, the more it stains. And I worry as doctors, is it staining the brain? So we, as early, it's preventable. So we don't allow babies to get yellow. If you are discharged early from the hospital, please every morning go out. Don't stand in your bedroom. Take your child outside with the bright light. Look at the skin. At times, just blanch at the nose, the tip of the nose. You see, if it's yellow, you would see it. If you are not sure, let someone see. These babies, you are waiting to see it from the eyes. They don't open their eyes. So by the time you're seeing it on the eyes, is almost wet. And it can spread very fast. Most of the time, it starts from the face, and that's how it starts. Immediately you're seeing a tummy, we are in trouble. The feet, we are off. So let's don't wait till then. If you are delivered at the hospital and you see it, please alert a doctor or a nurse to see it immediately. If you are at home, you are seeing, quickly send the child to a hospital and let them see. And if there's a need for investigations, to investigate. Because some people, some babies, immediately they get a joint, start running very fast. So the baby, oh, in the morning it's just in the face, so by evening it's down at the feet. But if you're in the hospital, they can do a blood test and look at the levels. The levels tells us to intervene immediately or not to intervene immediately and advise based on what they see. You see, I have highlighted no sunbathing. We are avoiding it because it's causing us a lot of trouble. Some will say, oh, so go and do some, my mother's hotel, go and do sunbath. That's what we were doing. Yes, sunbathing, I'm not saying the sunbathing doesn't work. But sunbathing may be what is causing the jaundice. Does not need sunbathing. And you might be doing sunbathing for 3-4 days. By the time you bring it to your child to the hospital, it's too late. What we normally do, we do physiotherapy. It's a blue light we normally put them in a machine. Or some places are like a bulbs thing, we put the child under the light. What the blue light does is it breaks down the jaundice and the child can pee and poo everything out quickly from the body. That saves the child from having any complications with it. Because one of the complications is cerebral palsy, and your child will be stiff. And can't imagine carrying a child for 9 months and the child becoming very stiff. Now, for the severe jaundice, normally we do exchange blood transfer. It means that we have to take all the jaundice blood out and replace it with normal blood. That's too much stress for the child. I don't think you want your child to wait and get severe jaundice for us to do exchange blood transfusion. Now, safety tips for all children. Now, I just mentioned, I'm just going to talk about just a few of them. Our number one worry of seeing at our emergencies is foreign body. It could be anything: coin, pen tips, batteries, beads, whatever. At times even parazole. I didn't mention, I didn't write it here, but even parazole, those are poisons. I'll talk about that under poison. So these foreign things, sometimes they can swallow. You might not even know. By the time you're seeing their poop, it means it doesn't cause harm. But some of it can be so big, it can obstruct their breathing, it affects their feeding. So they may have pain on swallowing, they might be drooling. If you see the child is playing, but this child doesn't drool, this child is dreaming, try and find out. If you're not sure, take the child to the hospital and let's investigate. Okay. Having difficulty in breathing, maybe abdominal pain, persistent cough, refusing feeds, or even seeing some blood in the stool. If you are seeing blood in the stool, please send the child to the hospital and let's investigate and find out why the child is having the blood in the stool. Now, some of the times, the slightly older ones, 2, 3 years, 4 years, even some 6 years, they even behave like that. They put things in their nose and their ears. So you realize, there's this particular nose is smelling. You're taking their bath, realize, this nose is smelling. Or it's just only one side that is dripping. Suspect it. They may have pushed something in. So either in their nose or in their ears, it might be discharging. It will happen the very first day. You see some days after or some weeks after. You might, please don't panic. Just send the child to the emergency room and we'll sort it out. That's where we are there for you. A few of them, depending on what it is, some cases we have to take the child to theater, depending on where the foreign body is. Just try to sedate the child and get it out. So that's why I'm saying that some management may need some intensive care for them. Poisonings. So poisonings can be anything. It can be an inhaled something, it may fall on the skin, it may even swallow. It could be parazole, it could be some toxic agent, something somewhere. It could be your perming cream. It could just about, kids can do just anything funny. It could be your shampoo, your medications. They can just push everything, especially the folic, the fesolate. They see the green thing. Oh, it's pebbles, it's toffee. They're just stacking a lot in their mouth. And you realize that, please don't panic. Take it from the child. If you see some in the mouth, get it from the mouth. Don't make the child palm. You see, I've indicated in the notes, no palm oil, because it causes more harm than good. The palm oil in the past, and grandmother's generation said it helps with vomiting. Yes, a child cannot control with their swallowing and breathing whilst vomiting. Adults, even adults, struggle sometimes. So some of the palm oil, in attempt of them vomiting it out, the palm oil gets into the lungs. That's when we get into trouble. So the child may have taken some palm, you might smell palm parazole, want something in the mouth. When you check, it's just the lip, because it doesn't smell good. The smell of it, the child wouldn't drink, just the smell. So it's best you come and let's examine that you giving palm oil or anything to induce vomiting, and that content getting into the child's lung. That's what kills them. So save us trouble and save yourself trouble by not giving them any palm oil. Just be calm and bring the child to the hospital. We'll sort the child out for you. If, let's say, it's a poison something, a toxic something that poured on the skin, take off all the clothing, rings with lukewarm water, not hot, lukewarm. Do the cleaning for at least 15 minutes. It's just to make sure. So you just rinse, just keep pouring. Don't rub, because sometimes you rub, it absorbs into the skin. So you just pour the water all over to wash as much as you. So the minimum is 15 minutes, and pour as much as you can on the skin. Yes, there might be burns. You keep doing, the child will fight you. Don't mind. Pour. Because the more the stain stays on the skin, the more it reacts. And if it's wet, burnt, it would worsen. If it's any irritation, it will worsen. Don't apply any shea butter or ointment on the area when you're done. You just bring the child to us. What's important, take off the clothes, wash all the poison out of the child's body, and rush the child to us. If it's the eyes, realize the eyes, I've gone into details, how to clean it. So with the eyes, let's flush the eyes, over, you say, flush the eye by holding the eyelids open. Children will fight, even as adults, we struggle. So they'll fight. So as you do, just lukewarm water and splash it. Please allow the water to run across the eye from outside the corner to flush it out. So just let someone hold and just pour the water at the corner of the eye and let it run through. Opening your eyes is terrible. So some are able to open. You can just flush the eye with water. Also, just with the lukewarm water. Then let them hold and wrap the child with the towel in one hand. That's how to hold them, because if their hands, they'll fight with you. So once you have your towel, wrap the child in place, and another person gently holding the hand, you can easily do that process. And also do it at least for 15 minutes. Don't apply anything, then bring the child to the hospital. Who will determine, look at it and decide. Because immediately you put something on, we can't examine. It affects everything, our examination and everything. Now, my next other thing is seat belts, car seats. There's, in a way, a little passion I have. I see children sitting in cars, they are not strapped. Some even driving, and the child is sitting in front. Please protect your baby. It's the men like doing it. I don't know whether it's nice. They have a nice baby, their car seat, and they'll put the child in front and they're driving. Please, you are the mother. You carried the child for 9 months. They did not. So kindly tell your sweetheart that you shouldn't do that. Every child should be in a car seat. If it's a child is less than 2 months, when you put in a car seat, put it the opposite direction. So it should be a rear facing. It means the child's back facing you. It saves the child, because just in case you break, that position saves your child from swinging forward and being thrown out of the seatbelt. That's why I said rear facing. So don't say, oh, I can't see my baby's face. No, we are rather saving you. So it should be the reverse. So the child should be in car seat. Someone asks, for how long does a child, even in the US, they sit until they are 8 and they get out of the seat. That's even how long they can sit. We have car seat, different age, depending on the age. Make sure they are in car seat. Until they get to the age, they cannot fit in a car seat and they are too tall for that. That's when you stop. Who sits in front of the car? Is children 13 and above. Less than 12, all at the back. Don't keep any child in front, please, because of the seat belt. Unless the child is a very tall child and just like an adult, then he can strap. But if it's small and then you realize that seat belt cannot really fit very well. So when you step on the brake, the child is to throw your child and it can get injured. That's why we're saying that 12 years and below, they sit at the back of the car, make sure they fix their seat belt. Not these children hanging and they are swinging with their hands out and they are standing and you stay down. Make sure you strap them in their seat belt and they are well seated. Other tips I'll talk about, oh, sorry about this. Other things I'll talk about is other safety tips. Do not hold your child whilst you are cooking. Maybe you say, oh, this child is disturbing me. So you're holding this child or you're holding a hot beverage or anything. So to avoid pains. Never leave your child unattended in a bed or anything. Even when you are putting your baby to sleep, don't put the child in the prone position. That's with their face down. No, always have a face up. Because face down, if it's a pillow, the child can suffocate. So always try and put the child with the back on. And if you have a stairways at home, please put baby gates there to prevent your child from falling. Never leave your child alone for other young children or even pets. or they can't take good care of your child. Oh, they are with their siblings. How old are they? Is it your 4-year-old or your 6-year-old? No. So please don't leave your child alone with your younger children. And child-proof your house before the child begin crawling. So if there's anything, you have to put some nets and trapdoors somewhere, please do. And avoid leaving things around, coins around and things around when your child is crawling. I think basically that's what I'll talk about. So thank you very much. If you have any questions for me, you can ask. Thank you. Akosua, I'm done.
Thank you, Dr. Baafi, for your time. It's been really powerful. I was making notes and I was even sharing. Yeah, I was sharing because it's a lot of things when mothers come, especially for CWC, and they are immunized. They want to quickly do the para thing, and they will keep giving the para until the temperature drops. So I was happy about the fact that you spoke about that and what it leads to. So thank you so much. We also wish you well. We want to ask our house if we have questions for Dr. Baafi, our pediatrician. She is available. So kindly unmute yourself if you have questions for Dr. Baafi. Hello. Hello, mothers and fathers. Do we have questions for Dr. Baafi? Eileen, Linda, Charity. Oh, the Nita is still here. Madam Rita, Maabena, anybody at all, if you have any questions. As for me, I think I really, it's very clear enough. So I am okay, but if you have any questions, she is available. Okay. I think maybe participants are as sure of everything as I am here. And so we'll say thank you so much to Dr. Baafi. We pray that the good Lord will also be gracious unto you too and replenish whatever you've lost for our sake. God be with you. God bless you as you end the year this year. We wish you well and the very best and hope to see you in 2022. Dr. Baafi.
Thank you so much, Akosua, and thank you for your audience. Thank you so much.
Thank you. Thank you. So
I hope I can leave now.
You have to be at the hospital. Thank you so much for making time for us. Thank you.
Right. Bye-bye.
Bye. Yes, yes, very insightful presentation indeed. Thank you so much. We will take a minute or two break. And then if you have any concerns, any questions, if you want to be linked to any of the two speakers who gave us the presentations, you can do so. And I will see to it that you are connected to any of them so that you can be attended to. If yours is very private and sharing it here will be difficult for you. So thank you so much. If we have any questions for any of the presentations, like I said, just leave it in the comment section below. If you don't, I will personally, you can send it to me on WhatsApp and then I'll make sure, like I said, I connect you to the doctors. So we'll take a minute or two break and then I will come in with the presentation. That is the nutrition aspect of the presentation. So Abugri, if you are here, just a minute break
Yes.
whilst we wait to take the next presentation.
All right, that's fine. That's fine. We can use some music interlude whilst we take some rest and come back.
Just for 2 minutes, so that if somebody wants to stretch or get water, like myself, I'm going to get water. So see you in the next 2 minutes.
Pikin, you make am go hungry. Now you go carry all the shame. We say sumo pikin na no sabi say make you dey manage you. Pata sumo pikin no sabi say make you dey tie. Pata my sumo pikin, you make am go hungry. Now you go carry all the shame. Yes, it's a very good morning, and it's important. It's very important for everybody to give top money. And if you are a father or you are a mother, you need to do it. Stomach no holiday. Hepa, sober. It's small pikin na no sabi say make you dey manage you. Pata small pikin no sabi say money no dey. Pata we say small pikin you make am go hungry. Now you go carry all the shame. Aye, small pikin na no sabi say make you dey manage you. Pata small pikin no sabi say money no dey. Aye, small pikin you make am go hungry. Now you go carry all the shame. Hey, fire. Hey, pikin, wake up in the morning. I say, where start the cry? Papa, some waiting be the problem. Baby say, I dey hungry. Ash, Mama go to Papa and tell him say, pikin dey cry. Papa vex on Mama, cause he spend money all for town. As Papa jump on Mama, they fight down. Pikin dey cry for food. Nowadays, that money no dey. You still spend your last coin in town. Wetin go happen for house? Hey, hi, pikin wake up in the morning. I say, where start the cry? Mama son waiting be the problem. Pikin say, I dey hungry. Hey, Mama go to Papa and tell am say, pikin dey cry. Oh, Papa jump on Mama, cause he spend money on for town. As Papa jump on Mama, they beat him. Pikin dey cry for food. Hey, pikin dey cry. Who cause oh, pikin dey hang oh. Who cause we say pikin dey cry oh, pikin dey hang oh. Papa and Mama. Who cause pikin dey cry. Who cause oh, pikin dey cry. Who cause we say pikin dey cry oh, pikin dey hang oh. Papa and Mama. Who cause sweet from the trumpet, and that's what it is. Oh, pikin wake up in the morning. I say, when start the cry? Mama son waiting be the problem. Pikin say, I dey hungry. Oh, Papa gets on Mama cause he spend money off for town. As Papa jump on Mama, they fight them. Pikin they cry for food. Hey, pikin they cry. Who cause oh, pikin they hang oh. Who cause we say pikin they cry oh, pikin they hang oh. Papa and Mama. Who cause we say pikin they cry. Who cause oh, pikin they hang oh. Who cause pikin they cry oh, pikin they hang oh. Papa and
All right, thank you so much. Welcome from the break. And yeah, we are up for the next session. Nutritionist Akosua will be joining us shortly. Thank you so much.
Hi. Yes, hello everyone. Merry Christmas to us all and prosperous New Year in advance to us all. So this is Nutritionist Akosua, and thank you for being part of this wonderful session. I will continue by moving on straight to our next conversation, which is everything nutrition, from preconception to conception to what you need to know about trimester 1, trimester 2, trimester 3. And then now, after baby is out, what do we need to know? Most of the things I wanted to talk about as far as baby care is concerned are two resource persons did mention. So it will give me the opportunity to also explain certain things to you. And if you have this book, what we call the MCHRB or the Maternal and Child Health Record Book, if you have one at home and you would want to pick it up, why not? Because most parents or mothers love to seek help from the private facilities. And the challenge with some of these private facilities happens to be the fact that sometimes everything that needs to be done for you and your child is not done. For instance, something like checking of MWAC, or what we call the mid upper arm circumference, is mostly not checked. What they do is that they just put your baby on the scale to check the weight, and that is all. But stunting can happen, and if your child is stunted, it can't be corrected after age 2. So what happened when the child was 3 months after delivery? All these checks are done, but what happens afterwards? Because you probably needed to move from Ridge Hospital, Kolebu 37, or the bigger hospitals we like to run to when we know that we want to make sure we deliver and are safe, we run to. But after delivery, we go back to our private hospitals, and some of these things are not done. And it's something that is a lifelong thing, because imagine your child being stunted at 2 and it can't be corrected. It means that this child, what we call a badadwa, that is all you have for the rest of this child's life. Nothing, absolutely nothing can be done about it. The harm has been done, and we have to live with it for good. So that is it. I'll focus on breastfeeding, exclusive breastfeeding, and then complementary feeding and how to do proper meal fortification for your child. And then feeding tips. So it will help if you have your MCHRB or the book they give to you when you go for weighing or antenatal. If you have it with you, you can pick yours. So I will start off by talking about preconception. And I was happy when Dr. Nita was presenting, because she spoke about preconception. I have no slides to share. I prefer talking like I do for my segments, where it looks like we are having a conversation. So I will give examples where I have to make it easier for us all. So I'll start off by talking about preconception, even though she mentioned it. So I'll just brush through that. Now, it's very important that before you conceive, you should make sure you and your partner, you have a healthy hemoglobin level, what we call HB. That is the reason why we give the folic acid, because if we were making the natural folates, then there wouldn't have been a need for folic acid. Folic acid is the artificial version. Folates are the God version or the natural version. And folate is very, very important because of the good it does to you in aiding fertility in women. So fertility has everything to do with your folate and iron stores. Make sure your hemoglobin for a woman is between 12 grams per deciliter to 16 grams per deciliter. That's the WHO, the World Health Organization recommendation for every woman or every girl. So from the child through to the aged, that is the recommendation. And for a man, mostly when we talk about fertility, I think we've moved from that era where the responsibility is shouldered by the woman. Now, the man is also heavily involved in pregnancy. And so for a man too, you have to make sure you are at 14 grams per deciliter to 18 grams per deciliter. So that's for a man as far as your hemoglobin levels are concerned. Now, that is the iron. The folate, every leafy green vegetable you are eating, every pulses, nuts, and seed. So leafy greens, if it's ayoyo, contomere, bokoboko, ademe, alefi, every leafy green. I love to stress on every leafy green because somebody might say, oh, I'm not from the north, and so I don't know ayoyo and bra. Another person might also say, I don't know alefi, I don't know ademe, I don't know bokoboko. So I mostly tell people that whatever leafy green vegetable is peculiar to you, looking at where you find yourself or where you are coming from, whatever leafy green vegetable you know is what I'm talking about. So if it's dandelion, if it's contomere, if it is ayoyo, if it is cassava leaves, if it whatever leafy green vegetable, if you also exotic and you know broccoli, you know spinach, it works for the folate. So they are naturally filled with folate. And so it helps with your folate stores. Now, because we are not making up to what we need, looking at where we are coming from and our method of cooking, it ends up destroying the folate sitting in some of our leafy greens. For example, if you cook your vegetables for 10 minutes, you are eating chaff. You've stripped the vegetable of every nutrient it can have. And so it's very important that we are careful as far as how we even handle our vegetables when it comes to meal preparation for the family to make sure we retain maximum of the nutrients sitting in that leafy green. So that is it. For a man, zinc is important and zinc heavily sits when it comes to helping the fertility of a man. Without a strong immunity, your fertility, everything about your health is compromised on. So for the woman, your iron folate stores is something you should pay attention to, and also make sure that your immune system is functioning properly. How do you make sure? Make sure you have vitamin A, rich foods part of your meals. I will talk about the 8 key nutrients and give you examples of foods that has everything. So we have vitamin C, we have vitamin A, we have vitamin D, we have vitamin E, we have selenium, we have zinc, we have iron, and we have folate. I was talking about iron and folate and being iron, every meat you are taking, every protein, so meat, egg, plant protein like soya, granuts, and even okra can help you. Okra contains protein, so if you are eating and you are doing proper okra stew, okra soup, and there is no meat in there, you are sure that you have some amount of protein from the okra itself. So our old folks used to say, "Oh, okra is meat," because of the protein that sits in there. Yes, so and for the vitamin C, any vitamin C, any citric family food, being orange, pineapple, watermelon, they all contain some amount of vitamin C, but the citric family foods have it in excess, like orange, pineapple, the lime, lemon, the acidic ones, they are heavily depositors of vitamin C. And we have watermelon, banana, mango also having some amount of vitamin C. Vitamin E, you can have some in the pulses, nuts, and seeds. So being granules, almonds, so the nuts and the seed food, flaxseed, and all that, they all will make sure your needs for these vitamins are taken into consideration. And so I always say that if you are eating a healthy or balanced meal, you are sure to make up for all these nutrients. You have your breakfast, you have your lunch, you have your supper, and do a snack a day. And for the snack, if I'm doing meal plans, normally I give it to clients as being fruits or something like Greek yogurt. Greek yogurt blessed with probiotics, it helps with your health as a woman, as far as the vaginal health is concerned. And it also helps with digestion. So there are people who gas and bloat a lot after taking certain meals. Aside the fact that you can do something about how you prepare the food, like beans, soak it overnight just to reduce the bloating you get, especially even in pregnant women. You can soak your beans overnight. And then as a snack, if you realize that okay, if I eat these kinds of meals, which I love to enjoy, I get bloated, you can have Greek yogurt for your snack. And that will help as far as taking care of that bloating and aiding in digestion as well. So that is that for fertility that I wanted to touch on. Now, conception has happened. How do we take care of conception? There are nutrients to be deliberated about. And when Dr. Nita was talking, making her presentation, she spoke about the fact that there is neural tube defects in babies. There is one called spina bifida. Is the reason why we give the folic acid. It reduces low birth weight, and everything runs on nutrition. If your HB is low, and there is a way to make sure you boost on your HB. One is to make sure you have iron-rich food in your meals, daily meals. So iron-rich food, like I said, every meat, eggs, every nuts and seed, every leafy green vegetable will make sure your iron and folic needs are taken care of. So if it's breakfast, lunch, supper, ask yourself, whatever I'm eating, am I doing justice to or seeing any of these foods from these groups in there? And there are stuff we call inhibitors. They are the reasons why sometimes we are not making enough blood. Inhibitors example can be, there are people who it looks like it's too bad to be true, but people are doing it. ILO, or what we call Chile. There are people who have pica or pica. And so, okay, I am craving for this. I want to put this in there. It could inhibit the absorption of iron. So it's just like forcing the horse to the river, but the horse drinking the water is another thing. So there are some people, they are eating everything I'm speaking about, but still their HB is very low. And they are like, what is she talking about? Because everything she's talking about, I am doing it, but why is it that my HB is too low? It could be that you are indulging the inhibitors I am talking about. Inhibitors, example, aside ILO, can be energy drinks. For a pregnant woman, I always tell my pregnant women as presentations that the energy you carry is bigger than any other energy. So why do you want to worry yourself by going for another energy in your quest to make sure that you are satisfying the craving? And I think with pregnant women, somewhere 2019, 2020, yes, early bit, they all come for reviews and they are all talking about Vitamilk. So I was like, when you come for A and C, is it that you discuss among yourselves? Obviously, yes, because if, for instance, sorry, if I had nauseousness, I was throwing up, and I discussed it with people at ANC, like colleague pregnant women, and one or two of them goes like, oh, I was experiencing that. I took Vitamilk. I'm using Vitamilk as an example. And so it took care of that craving, that nauseousness, or that vomiting. And so you should try it too. Then there is a problem because calcium sits in vitamin. Calcium is very important for even a pregnant woman when it comes to trimester 2. And for some women, it even goes beyond trimester 2 into trimester 3. But if you don't do it well, it can be an inhibitor. So normally, even with people on calcium supplements who are trying to correct their low HB, I tell them that let the distance or the interval between the medication you are taking and your meals be 2 hours. So that after let's say I ate my meal at 10 a.m. What's the time? I ate my meal at 10:43 or 45 a.m. Now, I can take my medication at 12:45, so that by the time I take that calcium supplement, which is good for the pregnancy, because you see, it involves the baby is sitting in your pelvic area. The baby is sitting in something bony, and we all know the role of calcium for our bone health. Calcium very, very important, but if you don't do it well and it interacts with the nutrient iron, it destroys every effort the iron and folate are trying to make in your quest to improve on your blood health. So that is something for us to also note as far as our nutrient interaction is concerned, as far as inhibitors are concerned. And there are people who enjoy a lot of the drinks. If you're pregnant, that is also an inhibitor, and that is something that can also worry your blood health. And so it's very important that we pay attention to that. At trimester 3, you need to be conscious of vitamin C. Obviously, your immunity and trying to make sure you are fit is being taken into account. Potassium-rich foods, very, very critical because of your blood pressure. There's something that happens that's pressure normally in pregnant women, especially when they are heading towards their third trimester, preeclampsia. It is very important that you make sure that your HB is always regulated properly to avoid some of these things, because it can be very, very bad. It can be very, very life-threatening. It has caused someone's life, someone I know, it caused the person's life. It caused another client of mine her pregnancy. As a matter of fact, she experienced that before I even met her as a client. So she met me just to make sure she doesn't experience that again. But she came to me because of the horrible experience she went through, and that is the reason her husband even had me to be her nutritionist and run with her throughout the pregnancy, because she doesn't want that life-threatening experience of losing the child eventually and almost losing his wife. So we have to make sure we are paying attention to that. And for all that I'm talking about, everything sits heavily in the book here as far as what needs to be done for you. And I know that some of our mothers here will want to go seek help from private facilities. I work with a private sector, private hospital, even though I'm into a public practice. So it's very important that I let you know what you need to know. So there is a page 9 here of this book. It will tell you what you need to do. Every pregnant woman is supposed to see a nutritionist 3 times throughout the period of pregnancy. Trimester 1, that is the first 1 month to 3 months, you see a nutritionist. Then 4 months to the 6th month, you see a nutritionist. 7 months until you deliver. For some people, it's 36, it's 38. For others, it's 40, depending on your time of delivery. You need to see a nutritionist. And for some women, I've seen them 4, 5, 6, 7 times, 8 times, because their HB is not up to where it has to be. And for you to go into labor with low HB, we don't want to lose the baby, we don't want to lose the mother, we don't want to lose both of them. We want to reduce low birth weight. We want to reduce your experience with NICU, that's the neonatal intensive care unit. When Dr. Dave was presenting, she said it's very expensive. That is where we treat jaundice. And so when your pregnancy has certain deficits, it puts you in a position to have the NICU experience, like I say. So you need to be mindful of what you are doing. I can see a question, some examples of inhibitors. Yes, thank you, Auntie Rita, for this. I am addressing that. So for the inhibitors, you need to, I'll go over that. Example of inhibitors, those who love to a lot, so the tea bags, any tea bags. Some of us are not good with reading labels, nutrition labels. And so whatever we buy, we just start using it. And in this thing, for instance, a lot of things flood our markets, and they can go as low as doing donkomi, and we all would want to buy them. But if we are reading the nutritional facts or labels to know exactly what sits in there is a problem. And sometimes they're also lying to us, so you can't even be sure. Because, for instance, somebody will put something on the shelf and call it juice when it's a drink. It makes it difficult for me and some people to trust even what they are buying. So to play safe, stay away from tea bags, because these are also inhibitors, especially if they are not calculated. And I know that there are some of us, we think we have heavy schedules. I have, it's not I think, I do have. If you are like me and you have a schedule that puts you in a position where you have to do a lot, and so you need to replenish your energy, instead of you making sure you are having a healthy meal, you prefer to go for energy drinks. We have Storm, we have Rush, we have Five Star, we have what have you. You want to have that as your means to rejuvenation, or you bringing back your energy. That is also an inhibitor because of the caffeine that sits in there. Caffeine is an inhibitor. It will inhibit the absorption of iron, and then it will do something locally. They say a real humbucha. That is what it would do. So please, let's avoid all these things. I know that they are not easy, but I always say that even if you're a pregnant woman, cravings should be you should indulge once in a while. Obviously, there are times I can go down my apartment here and go look for malt to buy because I'm craving for malt. It's allowed because we won't have birthdays all the time. Christmas comes once a year, but I'm not saying indulge, because Christmas is for a period. And so if you are indulging for a week or 2 weeks, that is enough to have you fall into crisis as far as your health is concerned. So that is some of the inhibitors. Now I'll quickly go on to breastfeeding. Now baby is out. How do we take care of breastfeeding? If you've had the NICU experience, or you should ever experience the NICU, make sure that you are breastfeeding. Breastfeeding is the sure tool. When your baby is at NICU, trust me, everything the child needs is breast milk. So make sure, please, just a minute. I've lost our hand. I'm letting the technical guide to add here. So make sure you are breastfeeding. I always say that if it's a cesarean session, an hour after a cesarean session, or after you've been brought back to the recovery area, make sure you request for your baby and start breastfeeding. Breastfeeding should happen within the first 72 hours after your child is born. So if I always tell mothers, if being in the hospital or the facility, you couldn't make sure your breast milk is you are breastfeeding, are you sure you'll be able to do it when you get home? Because for some mothers, they don't even have assistants in the house. So if you have nobody to help you in the house, if you have nobody to support you as far as holding your baby or taking care of your baby is concerned, you have to do everything you can to make sure your your breast milk flows before you leave the hospital, because babies can go without food for 3 days. That is 72 hours after delivery. After 72 hours, nobody would want to risk it, because if something should happen to your child, you can decide to take me on, or take the people, the doctor, the specialist, everybody taking care of you. You can decide to take the person on. And so to avoid that, I would want to do something for your child. Obviously, also because there are health reasons attached to that. Maybe your child's sugar level is dropping, and that is what results in mama mebanejia, or they didn't give my child food, they killed my child. Because after 72 hours, you can kill the child if you allow it. But you can do everything to make sure that breastfeeding starts within the first 24 hours after pregnancy, after delivery, sorry. That is if you had a successful delivery. I've met clients who, after delivery for 24 hours, were not even back. So for this mother, it will be difficult for you to initiate that within 24 hours. That is why God is so wise, so much that He has allowed up to 72 hours. So the child's blood sugar levels will be monitored If there is a need to move the child to the baby's unit for further assessment, it is done to make sure that every assessment is done whilst we wait for mother to recover and come back. As soon as you can move your limbs, you request. There are mothers who request for even their babies when their limbs, they are unable to even move their limbs, because definitely whatever the anesthetics did has to do with your lower part or the lower part of your body, they can feel the upper part. And so once their arms are available to hold the baby, they want you to give them their baby so that they start breastfeeding. Exclusive breastfeeding is you making sure you are giving just breast milk to your child for the first 6 months of life. And as specified by the World Health Organization, you should do breastfeed at least 12 times in a day. It's the reason why we say that babies should not sleep beyond 2 hours. You meet mothers who go like, oh, my baby has slept for 4 hours. I've been able to go through every chores of mine. And with time, you come back to us complaining that you are not making enough breast milk. Your baby is not suckling. Your baby stopped breastfeeding after a few months because it wasn't forthcoming. And nobody wants to be frustrated when it comes to eating. And these creators are very lazy. So if you start on a lazy note with them, they are already lazy. And so it will become difficult for you to achieve the results you want to achieve. You come to weighing people's weight, their babies' weight are huge, are big, and you think it is a lie. They are giving something to their children. I can testify to that there are mothers who are exclusively breastfeeding and their babies are doing well, looking big and plumpy like you want your baby to look. It comes with work. And it says you making sure you are breastfeeding and breaking the protocols. There are mothers who are breastfeeding every 1 hour. So if I'm breastfeeding every 1 hour and you are doing 4 hours, you don't expect to have your baby look like my baby. So let us do our best to make sure we are doing what is right and what is needful. Abubri, we've lost Kezia. I don't know if Rita Ahin is back, but please add Rita and Kezia, please, for us. So yeah, Kezia and Rita. So that is it. That is exclusive breastfeeding. So make sure no water, just the breast milk. You can start off by doing every 1 hour, 30 minutes. Now it's to help you to also make enough milk to keep for future use. By the time you are done with your 3 months maternity leave, you still have breast milk in the deep freezer. You can store at work. So when you are to the brain that the baby is not done breastfeeding. When you are out of the house, milk can be warm and then given to baby to make sure breastfeeding continues. As Krista mentioned, your baby, if you don't position your baby well after feeding, after burping the baby on the back, you burp until the baby belches. Sometimes it wouldn't come like the way it comes for us as adults, but you hear that sound. Do that. Make sure baby's head is tilted to the left or to the right, just to make sure that if baby should even belch, it will just fall from the left part of the mouth. That is, if baby is lying on the left. If baby is lying on the right, it will go from the right side onto the cot sheet or onto the bed. Now, if baby is lying with head up like this, it can go up, choking can happen, and if it enters the lungs of this child, that is where the baby can happen to your child you want for your child. on complementary feeding. Baby is done safe breastfeeding. Hooray! Well done, mommy. You deserve a star. We give a star. We give an award if you're able to do exclusive breastfeeding. That is if you are going to the government hospitals, family foods or complementary feeds. You need to make sure that meal fortification is happening. There are some others, they will just prefer giving cocoa with milk, cocoa with milk, cocoa with milk. A good way to make sure your child is eating well is you probably even incorporating the breast milk this child was eating into the feed you are going to introduce to this child. I tell mothers, you can afford infant milk, but you can also say that, okay, I prefer adding a bit of my breast milk, just a milk, to the child's porridge. Because it has a feel of what the child already knows, it makes it easier for the child to accept it because, oh, I can feel breast milk wasted. I always tell mothers that this child will grow up to eat what the family is eating. So why do you want to worry yourself preparing something special, something different? I'm not saying don't treat your child special, but keep it in mind that when it comes to feeding of the baby, it says the key word here is baby friendly. Baby friendly. If it's baby friendly, it means that baby can have it and you won't choke this child, you won't hurt this child in any way. That is what we mean by baby friendly. And so let's say you are having chicken soup. Obviously, chewing is not part of the thing for a child at that age. And so you may need to blend it. Blending it so that it's easier for the child to swallow is what we call baby friendly. Something that is comfortable for the baby, something that is friendly to the baby and doesn't put the child in any trouble or any problem. That is baby friendly. So for example, the family is having fufu with chicken live soup. Obviously, Christmas, a lot of families do that. You can decide to add potatoes. That is the orange flesh. I prefer the orange flesh. As a nutritionist, my focus is on nutrients. The orange flesh or the local one is naturally fortified with beta carotene and vitamin A. Vitamin A for the reproductive health of this child, vitamin A for the eye health of this child. Our eyes are the gateway to our bodies and everything that has to do with us. And so if you are improving on your child's eye health, this is something that is laudable and should be encouraged. We need to improve on our eye health. We need to improve on the reproductive health of the child. You meet children who, for example, especially the boys. A boy at age 5, their organs looks like that of somebody at age 1. And it follows them sometimes. They are 10 and they are embarrassed. They are in their early puberty age and they are embarrassed about what they have. Everything about their well-being, their appearance should be something that is of importance, or whatever you are feeding your child, make sure it is factored into the child's meals to make sure optimal nutrition is ensured. So the reason why I choose the orange flesh. Put it in your soup. Be careful when you start feeding a child. There are 4 things you should be watchful of: pepper, spices. Pepper is a spice, but I'll separate it. When I speak of spices, I'm referring to the boiling cubes. The cubes we have on the market with celebrities and well-known people attached to it. And so we are always on the rush to get them. The digestive system of this child is not so strong to break certain things down. And so we need to be careful. When a child starts eating, do you know if your child is G6PD? If your child is G6PD, there are certain foods, no matter how healthy they are, they can't have. An example is the fava beans. And for some people, for some children, if your child is full defect, if you don't know what I'm talking about, you can go to the hospital, tell them you want to know if your child is G6PD. A lab request will be done, samples will be taken, and then results will come out to let you know the status of your child. If your child has GSPD, there are certain foods like the fava beans. If it's food defect, there are some food they don't take at all, like soya, because you can push this child into a place called hemolysis. And hemolysis, that means that everything about the blood health of this child will be compromised on, and it can be fatal in rare cases. In rare cases, it can be fatal, but it can so happen that it can be fatal. You can lose your child. Like I said, it's not common to get to that place, but who knows if you may not, or you may never go free or be forgiven for not doing what has to be done. So that is it. So for the potato, you can draw some, or you can take your potato from the soup. Take some of the soup before you add your pepper and your spices and a lot of salt to the taste of the family. So you first some of the soup, take some of the chicken, and to further fortify it, you can even add carrots to it. Blend it all into a puree or porridge and feed your child. When you analyze everything you've given to the child with the 4-star diet, as recommended for us by the World Health Organization, that's how the whole world we are supposed to eat. So the stars are 4. The first has to do with the staples, what we call the carbohydrates. The second has to do with the animal protein. So every meat is in there. We have the fruits and vegetables. We have the pulses, nuts, and seeds. We have essential oils, fats, and minerals. So iodine, salt will come in there. We start our soup with adding some little salt to it, as what we call Baafi. So there is salt for the minerals and essential fat category. There is some amount of fat from the chicken, and there is the chicken will supply the animal protein, the potato for the staples. And so you can be sure that for this meal you are giving to your child, it is balanced. It passes the balanced diet score. It will be left with the pulses, nuts, and seeds. That is if for your family you don't even add beans. There are some families, they add beans to their live soups or their soups. There is this white beans they add. If you are adding the white beans, it means that you satisfy the whole protocol as far as the bowl of puree you are serving your child is concerned. That is how it has to be done. And then at 6 months, you introduce fruits to your child. You don't need to give something big. You can divide an orange into 4, take 1/4 of it, squeeze the juice out, and then with a spoon, feed the child with it. We should avoid feeding bottles for the sake of nipple confusion. If you use a lot of feeding bottles, your child struggles to determine the difference or to understand the difference between your nipple and the feeding bottle. With time, they are comfortable with the teeth because it's easier eating from there. And if the child is comfortable with that, suckling from your breast becomes a problem because now it is easier for them. They can easily get this. So why do I have to struggle? And that will cut off your milk supply. So make sure you are doing it well. You are fortifying your meals. And there are these fortifiers you should get as a mother. Get fish powder, soya bean powder, shrimp powder, granule paste. These 4 on standby. If the family is taking something that has meat that can be blended, for instance, you are having cow feet, you wanted to give yourself a treat, even though it's not the best or the healthiest, but you want to give yourself a treat, you feel for it, and that's what you want to have as a family. You can't blend cow feet and incorporate that into the child's meal. So you can just fetch a spoon, a teaspoon of the fish powder or the shrimp powder, fetch this child's meat, meal, soup, whatever, and just add it to it. There are sometimes you even have protein in there, but you still want to fortify because this child is growing in muscles, and so need a lot of nutrients. The nutritional needs of a child is serious and high. Eggs are very good for them. Eggs can be used to even correct stunting or the weight or the length, the bad length of a child. Always make sure that when you go for weighing and your child is 6 months, at 3 months, the length of the child needs to be checked. So ensure that at 3 months, the length or yes, they are young, they can't stand. So we say length is checked at 3 months, at 6 months, at 9 months, at 12 months, at 18 months, at 24 months, until your child is 5 years. You don't stop going for weighing. But I know that it's difficult for us in our part of the world to go for weighing with a grown up. But vitamin A needs to be given to this child until the child is 5 years. You don't stop taking vitamin A. Vitamin A is good for reproductive health, for eye health, like I spoke about, and for certain functions of the body. It's all good to help, and it all helps. There is this column in the book, page 50, that is for the nutritionist to record how your child is doing and to let you know the weight and the height, the plotting. So if it falls within the right Z score, then you can be sure that your child is doing well. The interpretations will be given to you, history of illnesses, where there has been any illness, anything that has compromised on the child's findings. It needs to be known so that it's addressed. But for most of these private facilities, it's not done. And so make sure if it has to do with your child's weighing, if it means seeking a second opinion or an opinion at a facility, a government of facility where all these can be done for you. And if it's a private facility like the private facility I work with, you can also get in touch and then everything can be done for you. So the feeding history will be taken into consideration, and then there are gaps that needs to be identified. Where there are gaps, you will be helped with the help of a nutritionist. You can be assisted. And then we have actions that we need to take once your child starts eating or is even doing exclusive breastfeeding, so that we can carefully make sure the physical well-being, the health of this child is placed at where it needs to be. And then additional assessments, like I spoke about, GCSPD, when you start feeding your child, if the child is not doing well as far as tolerating feed A, feed B, all that will be done for you so that your child's health can be properly assessed and the right interpretations given to you. So make sure you are careful about the MWAC. I didn't mention that at 6 months, the MWAC, that's the mid upper arm circumference of every child, will need to be checked. That is a careful way to make sure malnutrition is prevented from happening. Some of us or some of you, you have children who are not putting on properly, they are eating well, but this is not going on properly. Sometimes the pediatrician may have assessed everything, and there are times they are referring them to us because they have done every assessment they need to do, but something is just not going well. At that time, mostly it has everything to do with nutrition. And so we come in and help. So know your child's GCSPD status and know what to feed your child and what not to feed your child. The MWAC should be taken at 6 months, 9 months, 12 months, and then subsequently. So just as I mentioned for the length, to know the nutritional status and well-being of your child, so that if there is something going on, we can, as a matter of urgency, correct it. Because if your child is stunted, it will be difficult to correct it. We can do something to redeem the situation, but it is better we prevent it from happening than to correct it. It is difficult correcting it. And in some cases, it can't be reversed. If you have a family history of you looking that way already, then it makes it difficult because science can't break hereditary. So that is, in those cases, reversing it is impossible. Now, feeding tips for baby. When you take this book also, and you go to page 36 of the book, you can see the feeding pattern of the child. So at 0 to 6 months, the number of times the child is supposed to feed, the consistency of the feeding at 6 months to 9 months, how you do mashed pureed and blended foods. You feed 3 times a day. You introduce a fruit a day. I'm giving the portion or the serving of fruit for a child. If you give a child more fruits, diarrhea can set in, and that can be bad for the health of your child. A child running diarrhea is serious. It's serious. So we should avoid that. And then at 9 months to 12 months, finely chopped, and then 3 to 4 times a day, depending on the findings we have at CWC or weighing, 12 to 24 months, there is a way to go about it, and then 2 to 5 years there is a way to also go about it. So that is basically everything from preconception, once conception has happened, breastfeeding, exclusive breastfeeding, breastfeeding continuing from 6 months, whilst you do complementary feeding, meal fortification, until the child is 2 years where you stop breastfeeding. I know 2 years is a lot. People laugh at it, and there are mothers who don't do it, but I will tell you what has to be done to make sure your child stays fit. There are some children, the flu and colds Dr. Baafi mentioned, the pediatrician mentioned, they don't experience it. And it's because their immune system is so strong. They are so strong as far as their immunity is concerned, so much that cold can be passing, they don't see cold. Flu can be passing, they don't see flu. Whatever is passing, they do not see it. And that is where we want to be, where we have children who are fit. And if you are doing well as a parent to prevent mosquito bites, you can be assured that in the next 5, 6, 7 years, if there are no mosquito bites, your child knows no doctor. That's what we want. So that is it. That is the end of my presentation. If there is any question, any concern, anything you want to ask me, I am available to answer them. So kindly unmute yourself if you have any questions for me. And then one key note, we should all make sure we stay hydrated. For a pregnant woman, you need beyond the 8 glasses. So 8 glasses, the equivalent is 4 sachets. Now, when you get pregnant, you move to 6 sachets. And so it's equivalent to 12 glasses. It helps. And for us all as individuals, the 8 glasses will make sure that you are well cushioned and it prevents you from overeating. So that is that for preconception, perception, and once baby is in postnatal consent, you asking for your baby to be fed. If there are any questions, I can see questions from Aline. You can feel free to also share your questions.
Sorry, Akosua, you're muted.
So I'm sorry, I was muted. I'm saying that if you have any questions, I'm available. At 11:20, Maabena will take over. So I am ready for your questions if there are any, please. Thank you so much for your audience. I can see one question here. So I've listed the inhibitors. Thank you, very insightful. Thank you. Please, can you recommend a meal plan for expectant mothers? So a meal plan for expectant mothers. Now, if you are expectant, that's the question. If you are expectant, if you are pregnant, what I will ask that you do is to schedule an appointment so that your individual needs and goals can be met. But to start off, I would say that make sure you eat your regular breakfast. That is something healthy in line with the 4-star diet example of the protocol the World Health Organization has given us. So it should have the staples, the animal protein and products. It should have fruits and vegetables. It should have pulses, nuts and seeds. It should have, don't worry, I'll help you plan one right now. And then it should have the essential fats. So for morning, I decided to go for corn porridge, and I prefer yellow corn because I'm saying that as a nutritionist, I'm in for everything that has extra nutrients for you. I like the yellow corn because it is naturally fortified with iron. So God has naturally fortified it with iron for your blood health. So I can do corn porridge, yellow corn for that matter, have a bit of milk. Mind you, I know I spoke about calcium and iron being inhibitors, but then how much milk can you add to your porridge? So it also has to do with there are allowable errors. So you have to also make sure doing that you compensate for that, or you can decide to go for a handful of peanuts rather. So let's say I can have corn porridge, a bit of sugar in there, and then a handful of peanuts or granuts. And then have omelets, vegetables with fried egg, a lot of vegetables. And then 2 slices of toasted bread for my breakfast. That is very healthy. It is balanced. It satisfies the World Health Organization's protocol for a balanced or healthy meal. Then for lunch, I can decide to go for red. Red, the beans from the pulses and nuts family, a first-class protein for that matter. It works for the vegetarian, it works for the non-vegetarian. And then my cocoa or my ripe plantain for the staples. Obviously, you will have some fat because you may use oil, red oil, or vegetable oil. And then minerals, obviously, because you will add salt to it. And then for my supper, I can decide to go for mputomputo. Now, if you're pregnant and you have something, if you have blood sugar spike or gestational diabetes, I wouldn't recommend that you use cocoyam for your mputomputo. You can use potatoes for your mputomputo or yam for your mputomputo. Cocoyam, because once cocoyam is cooked, the glycemic index goes up. And so as soon as you eat it, the amount of sugar being released into your system is really, really, really big and much. And it can put you at risk of recording higher figures, and it can be very bad for you as a pregnant woman. So that is it. And for your snack, you can decide to go for an orange because I told you vitamin C is an enhancer. It will help you better absorb every iron in the foods you've eaten for the day. So that is a day's meal plan for you if you're pregnant. And for a pregnant woman, you should try to Abugri, we've lost Rita. Please help her because she asked the question and she's saying she's struggling to join. So
Okay.
so you can do I've lost what I was talking about, but that is a meal plan for you. And for the iron, the orange, for example, as I mentioned, it will help you better absorb every iron in there. So depending on the condition you have, so for expectant mother, if it's a normal pregnancy, you don't have any health issues with your BP, your sugar, if there are no challenges, you can work with a meal plan I gave as an example for a day's meal. But if you have health issues, then you need to seek professional one-on-one consent so that the right thing will be done for you. If we have any more questions, I am open. If not, we will welcome Maabena. And so I wish myself a very blessed 2022, and I wish you all safe. And it's been a pleasure having you as my audience for my session. Thank you so much, and God bless us all. Maabena, if you are ready, you can take over. Thank you.
Hello, everyone. Can I be heard?
Yes, we hear you.
Okay, and can you see my mat? I will be presenting from here, so I need for everyone to be able to see my exercise mat. Let me just adjust my. To better see my mat. Okay. This should be okay. Right. Hello, everyone. My name is Maabena. I am a fitness coach. I've been coaching for a decade now. And I will be taking you through some very important pointers you should know as a pregnant woman, as a nursing mother, post-pregnancy, getting yourself back stronger and healthier, after baby. I know from my work that the most I think the most asked question that I get, most asked, like 90% of the time, is coming from new moms, and it's, what do I need to do to get back in shape? From as early as 2 days post-delivery to a few hours after delivery. Like women, I get women calling me or texting me maybe 5 hours after they deliver their baby, and they're asking what they can do to get back in shape. And I know it's a very difficult, a very scary, a very lonely, a very unsure season of our lives when we have just delivered a baby, because the realities we face are so different from what we thought it would be, like what we imagined our post-baby would look like, and what it actually looks like is so far apart, and it's so scary, and I will just let you know, if you're a pregnant woman, or if you're yet to be pregnant, if you're a nursing mother, if you're a toddler mom, if you're a teenager mom, that it's never too late to work on yourself and be patient with yourself. The birthing, the pregnancy, the birthing, the post-birthing is also traumatic to the body, to the mind, to your finances, to your social life, to the home. It's so destabilizing that you need a lot of good energy around you and within you to get to heal and for things to normalize around you. And the last thing I would really advise you to worry about is how soon you're going to get in shape, because seasons change. No matter what happens, you will get in shape. So with this one said, let me just get right to it. You can leave your questions as you've been doing, and then I will get to it. Or if you have any questions whilst I'm doing the demonstrations, I'm not going to be reading to you. Mine is going to be more of demonstration, because of course what I do is practical. So as I'm doing the demos, please join me. I will be very happy if you join me, so that you will be able to practically ask feasible questions, like realistic questions. And it's not like you're just watching the TV and then you're asking questions depending on what you think is or is not. Okay, so I will start with the role of exercising in aiding in proper dilation or smooth delivery. There are so many exercises. Let me start with so many exercises you can do when you're pregnant. I think I did a TV interview recently, and it was on pregnancy and exercises you can do when you're pregnant. And I know we have this misconception that when you're pregnant, you don't have to lift the finger. When it comes to exercise, apart from your regular chores that you have to do, you don't have to lift the finger, because exercise is so dangerous and all those things. But information is available now, and there's so much research done. There's years and years of physically, going through these things, experiencing them. So we speak from a place of knowing that it is very good to exercise when you're pregnant. Pregnancy is like running a marathon, or when you sign up for a marathon, you can't just get up one day on the day of the marathon and say, I am coming to run. You need months and hours of training. It's the same thing with pregnancy. When you're pregnant, you need hours and hours of training your mind, your body, what you eat, strengthening yourself in ways for the D-Day, the day that you go into labor and deliver your baby. And so if you don't prepare adequately, it will have its effects on you. And with that said, I would also say that let's try to have a habit of exercising before we even get pregnant. Just have a habit of exercising. If it's difficult for you to do it on your own or alone, you can join your area Keep Fit Club. I know they do once a week. It is not too bad. At least what I say is that doing it doing something is always better than doing nothing at all. Okay, so instead of just not doing anything at all, you can join your area keeping club for that once a week exercise. It will do something for you, or at least you will network. Or there are a lot of TV stations that do these early morning exercises. You can join them. You can sign up on WhatsApp group with your friends, you know, and be each other's accountability. I know you can't keep it for long, but at least for the period that everybody will have the room to do it, go through it and do it. You can sign up with me if you need someone to be on you and be checking on you, because you have paid money to me, I will do that job for you. So there's so many ways to get it done, rather than just, you know, being there and not doing anything, because exercising helps your cells to what do we call it? It helps you to not age too quickly. Let me not get too sensitive. It helps you to not age too quickly. It helps your brain to stay alert for longer. Okay, so there's so many things exercise does for you. It helps you to manage stress better. It helps you to manage pains and aches better. It helps you to heal better. It helps your immunity. It helps your mood. You know, there's so many benefits of exercise. It's not just for weight loss. Exercise is always boxed into weight loss, but it does so much, so much. Exercise does so much for me as a person. It goes way beyond. I've passed weight loss. I mean, I don't exercise because of weight loss. I exercise because I want to be able to eat, as you know, diversify the things I want to eat. So then I exercise so that it will not, I will not pile on the calories and pile on the fats, you know. Yeah. So let me just get, if you leave me, I'll come and talk and talk. Let me just get to what I should be talking about. So the role of exercising in aging or smooth delivery. Okay, let me just, like I said, please join me, whether you're pregnant or you're a nursing mother or you are a teenage mother, or if you are here with us, please join me. Why? This one is not difficult. Cry. So I'm just going to show you some few exercises you should do when you're pregnant to help strengthen your pelvic, you know, develop your pelvic muscles, strengthen your core muscles. You know, baby stays in your core. It's not just that. The ab is a function or part of a whole build or a whole compost of muscles that holds us together. Okay, so I know we are always worried about our abs or our stomach or our six-pack and all those things, but the strength is not from, it's a unified work from the back, from the waist, from everywhere, pelvic area. All of it is called the core, and it's the core that helps us to do a lot of things, to turn, to bend, to bend backwards. A lot of the movements that we do to hold baby in there is the core. Okay, so we need to remember this. It's very important. Sometimes when we have low back pains, it's because our core is weak. You know, and you will be doing a lot of ab exercises or crunches or all those things, forgetting to build the back muscles too. See, so like with that said, these are some of the. Let me do about 3 or 4 exercises that you should do when you're pregnant to help you build or strengthen yourself, or prepare yourself best for delivery. Not to say that it is what is going to do all the work for you at delivery. Of course, you know that your health professionals, you need God's intervention, you need grace, but this is also going to help. Yeah. First exercise I would want us to do is called the child pose. This is a position that helps to stabilize your pelvic region. You know that when we are pregnant, the pelvic area really suffers the impact because the baby literally, the heavy load literally sits on our pelvic. And sometimes the ligaments will open, sometimes the pelvic will open. For some women very wide, some women not too much. and all. So we need to at least prepare our pelvic as it's going through all this trauma. You know, we need to help it as much as we can. And one of the best exercises to do for that is the child pose. How do you do the child pose? You come on your knees, you will sit on your heel, you will make sure your buttocks is not raised higher than your chest or your heart. You will open your legs as much as you need to. As your pregnancy progresses, I'm sure it'll be uncomfortable because the belly is so big. So you can open your legs as wide as it will take. And then you go down like that. Relax your elbows on the mat, on your bed, on your sofa. It doesn't have to be only on the mat. You can do it on your bed, on your sofa. I know that during pregnancy, a lot of the joints hurt. So you can put a pillow right under this knee, a pillow under this, or a towel, roll a towel, put it under your knee, put it under this knee, put a towel under your toe, where the toe will lie on the floor, so that everywhere is feeling pampered, right? And then just lean down, relax, and breathe. Relax and practice, you know, slow breathing. Just take the air into your nose, exhale through your mouth. If this is a bit too uncomfortable for you, you can also rest, plant your elbows down and rest your head in your palm, like that. This is a very relaxing position. Even now, I do a lot of child pose in my exercises, especially when I'm doing mat or floor exercises. I do a lot of child pose too for my rest periods, you know, because it's very relaxing. You can start your child pose very slowly, because you can't just progress from nothing to opening your legs so wide. So you want to start this right from your first trimester. So by the time you are in your third, where the belly is so big, your inner thighs are used to what you have been doing, and it will easily go out all the way. It's so relaxing. So that is the child pose. The next one I would want you to know is the deep squat. This one you can do watching TV, you can do sitting, you know, relaxing anytime. You can do it anytime. And it's best also when you do it with support. So here is the deep squat. So let's say you're sitting on your sofa, you're watching TV. So you get off the sofa, place another chair in front of you, open your legs really wide, and sit deep. So this chair is just supposed to help you so you don't, you know, topple down backwards or anywhere. Of course, the sofa will be behind you, so if you're going backwards, the sofa will catch you, right? You just sit deep. Let me turn so you see what I'm doing. So this is what I'm doing. I'm sitting really deep. My pelvic is right here. My elbows are sort of pushing my knees open. And I'm just breathing. Relax, always relax your shoulders. It adds a little bit of relaxation to every activity you're doing. You realize that our body is so tense from doing so many, you know, activities that when we are stretching, we're still in a very tense position. So one of the best ways to relax, to ensure that you are relaxed, is to pull your shoulders away from your ears. Unconsciously, we always do that. It's a tense position. So take a deep breath and pull your shoulders away from your ears. You will notice that your neck will instantly get longer. So this is your deep squat. You can also, like I said, if the sofa is behind you, you can deep squat and lean on the sofa. So it's not like your whole body weight, the belly and your head and everything is resting on your knees. Like I said, pregnancy sometimes make the knees very sensitive to these things. So just lean backwards. So let's imagine that your sofa is, you were sitting down, you get up, you kneel like this, you squat like this, and then the sofa is behind you, giving all the support and the pampering you need, right? So this is deep squat. It actually prepares your pelvic area. It strengthens it supports, it gives it good support for when you're ready to push your baby out. Good. And then one of the movements I know a lot of people are aware of is the Kegel. Okay, Kegel. Kegel is so important. I love Kegel because it practically, like, you can feel its effect when you are in labor and post-labor, especially. You know, pregnancy, especially when you deliver your baby via vagina, because of the trauma of the baby coming out, your whole perineum and your pelvic area, everything becomes so traumatized. So it can take, for me, my first pregnancy took me about 6 months for my perineal area for me to feel like it has gained control. I had urinary incontinence for about 6 months before it corrected, and I used just Kegel exercises and bridges to correct this. Another problem that you might have is long-term urinary incontinence. So we really need this perineal exercises when you're pregnant, post-pregnancy. I mean, even before you're pregnant, try doing these things. When you know you are preparing yourself to be pregnant, start doing perineal exercise. It really helps. It's so important. One of the very important things because when you have urinary incontinence, it's so uncomfortable. You just have to cough, then urine is coming. If you feel like urinating and you don't run, you will pee on yourself half of the way because the whole muscular system is weakened from the baby coming out. You know, it's such a trauma. Let me just try and see if I can lift this a bit. Good, for you to see what I'm about to do. Please, can you see me standing? Is it okay? Can you see me standing? Put a yes or something. Okay, so let me do the Kegel for you to see. You can do Kegel sitting, you can do it lying, you can do it standing. I'm just choosing to stand to show you. So when you're in the kitchen washing, you can do your Kegel. So the Kegel exercise is basically just holding, squeezing your anal opening and your vajayjay together. It's like you want to bring the vajayjay opening and the anal opening together. Okay, so you squeeze the back forward and you squeeze the forward back. I hope you get what I mean. So it's like urine is coming and you want to stop it. Yes, that's simply how Kegel is. So that's why you don't really have to be in any particular position to do it. Okay, so just squeeze, release, squeeze. You can't even see me doing anything, right? Squeeze, because it's all right here in there. Squeeze, release, squeeze. So you do 8 times squeeze, release, you rest. You do it after about 10 minutes, you do 8 times squeeze, release. You will not see anything happening, but it is such a good thing to do, especially for strengthening the perineum after delivery or preparation towards delivery. I would advise that you start doing it when you're pregnant, so the impact will not be too much on you after baby. I hope you get what I mean. Yes. Another one that you can do is bridges. But the thing about bridges is you can do it you can only do it maybe from your first trimester till about 4 months when the belly is not so heavy, because you can't lie on your back for too long when you're pregnant. So you can do this pregnancy, just the very few months when the belly is still light and you can't feel it much. So you lie on your back, place your palms down facing the floor. Your knees are lifted at 90. You just lift your pelvic off the floor and squeeze your buttocks, squeeze it. It's very important to squeeze the buttocks. Okay, so squeeze and bring it down. Squeeze and bring it down. This is also very, very,
Abna,
very.
we can't see you.
Oh, okay. Yeah, because I turned the thing down. Okay, now you can see. Yeah, so here we go again. So you're lying on your back, your palms are facing the floor, relax, your elbows are relaxed, your shoulders are relaxed. And for you to be able to relax, just wiggle your spine, you know, when you wiggle it a few times, it gets the message that you want everything to relax. Good job. Now you just lift your whole waist area up from the floor. Lift it as high as you can and squeeze your buttocks together. You know, give it a good squeeze and then down. Lift it, squeeze and then down. What this does is that it strengthens your bum, your whole buttocks area. The buttocks or the glute muscle, it has so much importance to our movement. To be able to even move your leg, add one leg forward and the other forward, it's because your muscles, your buttocks muscles are activated. To prevent excessive waist pain, it's because your buttocks muscles are activated. So when we sit on our butts for too long and we don't exercise, this is how come we have so much excruciating waist pain. This is how come we have a lot of back, you know, pains coming towards our back area, because we don't allow the buttocks muscles to do its work in our body. Okay, so what did I say? Lift and squeeze down. Lift and squeeze. I hope somebody is doing this with me. You are not just sitting behind your PCs and phones watching you. Lift and squeeze. Let's go. Lift and squeeze. Down. Lift and squeeze. Good job. Down. Lift and squeeze. You can do these exercises, when did I say, in your very first trimester, when the pregnancy is not advanced, and up to about 4 months when you can still move around and you can't feel the weight of the pregnancy too much. Right after baby comes out, you can do this activity. Why? Because it is safe. There's no high impact. You're just lying down and you're doing this. So it's safe to do it right after delivery. If you had CS, as soon as you have done your 6 weeks, you've gone for your 6 weeks appointment, and doctor has checked and says everything is okay, you can do your pelvic lifts because it is safe. All you're doing is lifting your pelvic and squeezing your butt together. You can also do your Kegels because all you're doing is squeezing your BJJ and your anal muscles together, right? Yeah, it has nothing to do with the area of the TS. Okay, let's move on to what routines are considered. I didn't ask first. I need to ask first. Hey, how could I not ask first? So one of my favorite exercises, any time of my life, whether I'm pregnant, whether I've had a baby, anytime, even this morning I did squats. It's squats. Squats are so safe. Squats are so effective. And for after delivery, when you want to lose weight, please start with squats. It is safe. It is effective. It is safe. It is effective. It is safe. It is effective. Squats should be your best friend. If you have knee problems, do assisted squats. If you're still having problems with your knees after delivery, I know some women do, just do assisted squats. So get a chair or stand by your wall or something that you can hold on to, okay? And then just do a deep squat. Let me do this one again. Okay, so here we go. Are you doing it with me? Do it with me also. You can learn how to do proper squats. I see people leaning on their knees, you know. Don't let your knee take the weight of your body. If you're going down and you're feeling the impact in your knee, it means it's what is wrong. You should not feel any impact in your knee at all when you squat. It should all come down this way. Good. So here we go. We sit back, sit back, not on your knee. Back and when you come up, you squeeze your buttock. Okay, so you're not bouncing on your knee when you come up. Don't jerk your knee. Don't do that. Don't let your knees jerk. No, when you come up, you squeeze your butt so it takes the load from the knee. You get it? I hope someone is getting this. So let me turn this way too and show you. You sit backwards. The best way to see a proper squat is actually on your side. So you see the angles, okay? So backwards and up. Squats are great. Squats are a great way to shape up your abs, to shape up your thighs, to get rid of what's it called? I forgot the name. To get rid of visible fat lines. Squats are just great. It will make you sweat and all that. Okay, now let's go to what routines are considered dangerous for pregnancy. Well, there's so many of them. Any activity that you have to jump, any activity like skipping, no. Like intense jogging, no. Like running up the stairs, no. Like doing crunches, no. All these activities are not safe for you when you're pregnant. In any case, when you're pregnant, there's very limited activities you can do. You yourself, you're not even feeling up to it anyways. But it's different for people who were active before pregnancy. For instance, me, when I'm pregnant, I'm still able to lift weights, I'm still able to jog, I'm still able to do all those things because what I was doing it prior to my pregnancy. So my body already knows it. It's not now that I'm pregnant and I'm also going to introduce new things to my body. No, already the body is under a lot of stress with the pregnancy. Are we getting somewhere? I hope we are taking note of these things. And then finally, I would want to share with you tips and workouts to get body back in shape. Of course, this is my zone. I love this part. To back in shape after CS or SVD. Like I said before we started, your focus should not be your focus in the early days should not be weight loss. Let your focus be on sanity, energy, good sleep, good function. Sometimes when we are so tired and we lack so much sleep, we become foggy. We are not able to reason properly. It happens in pregnancy, it happens postpartum, especially the early months of postpartum when the newborn is literally depending on you for every little thing. It becomes very, very stressful. Exercise is one of the best ways to relieve yourself, to have a little me time, and the benefits are enormous. I just want women to start realizing that exercise goes way beyond. Exercise is mental health care. Exercise is your sanity. Exercise is boost of energy. Exercise is good mood. Exercise is bringing your mind back to taking care of yourself. Exercise does all this. Exercise is healing. Exercise is healing. So for you to even heal quicker after delivery, exercise will help do that for you. So please, let's not focus all on lose weight, lose weight. When all these things start happening, you will notice that your body is also shaping up. Okay, when you focus on lose weight, it stresses you because your expectations and your reality have such a wide gap. It starts putting too much unnecessary stress on you. So ladies, please listen to me. Let's be patient about the weight loss, especially in the early months of delivery, and just focus on building energy so that especially if you have other kids, you will have the energy to still take care of them, and you don't have that mommy guilt that I'm not giving my children the attention because you yourself you're not well. Yeah. So here are some of the activities we can do to get ourselves in shape after delivery. It doesn't matter whether it's CS, it doesn't matter whether it's SVD, everything, whatever you went through. Look, there's a way out, and I really love to teach about, especially postpartum depression. I'm not saying that it will prevent postpartum depression, but it will help you deal with it. It will help you manage it well. Okay, yeah. So my number one exercise, like I told you, is squats. Don't forget your squats is very important. If you can start from 10 squats, Please don't do 10 squats after 10 days of squatting and say, oh, I'm still doing 10 squats. No, you do 10 squats today, tomorrow you do 15 squats. The next day you can rest, don't do any squats. The next day, don't do 20 squats, so try 30 squats, you see. Then like your target should be 100 squats. If you're able to do 100 squats in like 2 or 3 minutes, hey, you're a champion, I'm telling you, you are getting there. You are getting the cry. And then you can after about, but it's different for every woman. When you notice your baby now has a schedule for their sleep, you can fit in an exercise in there. I remember after my first child, I think around 6 weeks, or was it 4 weeks or something like that, I realized that he sleeps longer in the mornings. So even though I didn't get enough sleep at night, I would get up, wear my running shoes and go and just walk. I would walk, time myself. I know that, you know, in about an hour, he would wake up, so I would go walk in the morning and come back. It made me feel so accomplished. Like the time when I'm walking, I feel so good about myself. You know, it's not the constant environment that I'm in. I get to smell, I get to see, you know, the sun shining, I get to feel, you know, the sweat, I get to feel, and it was something, it was such a time that I cherished. And I tried to do this at least 3 times a week. It was so helpful for my healing, so helpful. So please try and walk. If you can't go, your area is not safe, please walk in your compound. Just time yourself. I'm doing this for 30 minutes and then walk, really brisk walk. Brisk walk. 30 minutes and you're done. If you have staircase in your house, praise God. If you have staircase, it's so good. I'm not asking you to go up and down the stairs. No, just the first step. Just the first step. Let me use this to show you. This is one of the activities. You know, after delivery, that's not the time to sign up for the gym. No, it's the wrong time, because you will waste that money. You won't go. The time will take you to drive to the gym and back. Your baby will be awake. Your breast will be leaking. You get it? So just the 20 minutes, the 25 minutes, the 30 minutes time that you get, don't go on Instagram and be pressing and be lying there. Already your back is hurting from breastfeeding. So try things that will help you heal rather than things that will still, you know, keep you in that situation. So let me just use this, my short stool. Can you see my stool? Guys, can you see my stool? Please, if you can see my stool, say I.
Hi.
Awesome. So let's just pretend. Good. Let's just pretend that this tool is my staircase, the first one. Okay. So you're going to always keep your eyes on the stairs so you don't trip, because new mothers are also very clumsy. Yeah. So up, down, like this. Up, down, up, down, up. Keep your eyes on your feet so that you don't trip. Up, down. You can even add music. Then you'll be, you know, shaking your body small. Hey, down, hey, up, hey, down, hey, up, hey. See, doing this maybe 20 times, then you rest. Then you do another 20 times, then you rest. You can also hold 2 bottles of water in your hand if you don't have dumbbells. If you have dumbbells, praise God. Hold those dumbbells as you go up and down. Add a little rhythm to your body. So just make it your self-care time, and you will really enjoy it. Don't make the exercise as I have to do it to lose weight. No, see it as something that is helping you to gain back, regain your energy, regain your good mood, regain your sanity, better sleep, all those things. And it will do all those things for you. Okay? Yeah. And for now, I don't know, Akosua, how much time do I still have, if I can still go on, or I will take questions so that I will use the questions to just.
So I think you should take questions so that we will use the questions too.
Yeah, I am ready for you guys. If you have any questions for me, and I will use those questions to do, if it requires me to do more demo, I am ready to do more demo. So where are the mothers? Where are the pregos? Let's go. I'm right here waiting. Hi, Charity. Hi, Eileen. Hi, Casey. Eileen, ask me questions though. I'm here. Any questions
In
for
fact,
me? Oh,
everybody has to
something.
ask questions to end the session.
I know, right? Let me see if there are any new questions here. No, I don't see any questions here. Okay, if you don't have any questions, then please let's all come up. Let's all come up. Let's all get up. Let's all get up and stretch before we end. Please, are you up? I need everybody to come up. Oh, stand up. I'm sending angels to watch over all of you. If you don't get up, they will pinch your buttocks.
We are up and stretching.
Well done. Okay, let's start with just shoulder release. Release your shoulder. Just roll them from forward to back. 1, forward to back. 2, forward to back. 3. You notice that as women, a lot of our chores.
Maabena, there is a question for you.
Everything. Oh, is there? Do you have training sessions for expectant? Oh, yes. Yes, we organize training sessions for expectant mothers. But these are not regular. Usually, you know, expectant mothers, everybody has their different time of day when they are very active. Some people are active in the morning, some people are active in the night. So usually we have one-on-one sessions where a trainer will take an expectant mother through sessions which are scheduled. So you can talk to me later to get this done. So yeah, whilst we're on it, let's roll our shoulders forward. Please keep your chest out, don't slouch, because all day we are slouching in the office, in the kitchen, breastfeeding, it's like this. So roll your chest out, stand tall, and roll your shoulders forward. 2, 3, 4, and 5. Good job. Let's do trunk twist. This is one of the easiest exercises to do to shrink the waist. One of the easiest. Just stand. Don't move your pelvic. Don't move your hip. Okay? Don't move the hip at all. Just move your upper body. So we're going to just turn 1. That's all. Turn 2. Make sure the lower body is not turning with it. Turn 3. Turn 4.
Oh, there is a question.
Okay. Someone said they can't hear me. I hope it's corrected.
Okay, and then,
oh, it's the same person.
Yeah, it's Eileen. There is another question.
Is there another
Can I exercise if my pregnancy is delicate and I'm a bit old, like somebody who is older and then with a delicate pregnancy?
No. When it comes to delicate pregnancies, no, it's not advisable to exercise. Even the smallest, even stretches, especially if your doctor has told you specifically that this pregnancy is delicate, please, let's just stay off the exercise. I mean, you could do some stretches and meditation, but even that, you would need professional help. But I would just say, you know, it's just a season. Right after baby is out, which is what we all expect, you can get gear and then start doing all the things you couldn't do, okay? Yeah. So I would just say, just stay off exercise. If especially they've asked you to stay off all other home activities, then it means that you have to stay off exercise, okay? But if it is not that serious, then there are so many safe and effective things you can do, like, you know, slow Pilates, stretch movements, meditation, breathing exercises, all those you can do. So you can contact me after the this presentation. Any other question? Should I go on with the waist cinch? Because I know all of us want our waist small. Yeah, so we are doing the waist cinch. So keep your pelvic facing forward and then turn your upper body on your trunk. So 1, 2, 3, 4, 5. So you can do 10 each side. If you have a dumbbell at home, or if you can fill a bottle of water, a bottle with water or with sand. Hold it right at where your navel is. Okay, hold it where your navel is, and then twist it 1. So you notice that I'm not twisting my body. I am twisting the weight in my hand. So it's just a little movement of the muscles around your navel. Everything else is facing forward. So 1, 2, 3. This is very good to shrink back the belly after baby. Very, very good. Let me turn to my side so you see what I'm doing. Just don't do this. Don't turn your body. When you turn your body like this, you're rather shrinking the waist and not the belly. Turn the body like this, it is shrinking the waist. Move just the navel area, it is shrinking the belly. I hope you get the difference. Good. And then now our last movement before we close is knee up. 1. Come on, let's do 2. Come on, let's do 3. Come on, let's do 4. Come on, let's do 5. This same knee up movement, you can do it diagonally. So you bring your knee, left leg to right side. So 1, 2, 3, 4. These are very basic activities you can do at home to keep yourself active and energized. Thank you so much for your time. And Akosua, I will bring my presentation to an end here, and I'll be glad for any further questions. I like questions, so I don't know why the questions are not coming.
Maabena, I think maybe you should share your social media handles and your contact so that if they want to reach you.
Okay, I will put it right here. You can find me on Instagram.
Okay, I have a comment question.
Okay. Here we go. So that is me, Fitvolution with Maabena. You can find me on Instagram. I'm very active on Instagram, more than I am on Facebook. So a lot of my activities are on Instagram. Or you can reach me on, do I have to put my number as well, Akosua? Can I put my number? Okay, so you can also reach me on 0233 563008. It's a Vodafone line. I'm on WhatsApp, very active on WhatsApp. You can also call me. But I have toddlers, so if you hear me, you call me and there's chaos, just know that I want you. So that's my number.
We'll email everything to them, and so I'm sure for the people who even missed the sessions we had, they can still benefit and then get your number as well. So I'll share it.
Thank you so much, everyone. Thank you so much. Yeah.
God bless you so much, Maabena. We do wish you the very best of 2022 too. So see you in 2022. We thank you so much. We pray that the good Lord will replenish everything you've lost for our sake. We are so, so grateful. Thank you so much, Maabena, and bless you. Bless you. Thank you, everybody, for being part of this session. We are so, so grateful to you. I thank you so much for subscribing. We'll do well to share the content with you via email, as said. And so on that note, I would like to thank you all for being part of this. Abugri, thank you so much for everything. Kezia, oh, you're welcome. Thank you so much too for being part of this program. Hopefully, our subsequent ones will have a lot of mothers joining, because we all have seen how great it's been. I have gotten to know that too much para is bad for the health, the liver of our children. That is what I am walking away with, because para is really, really well abused by moms. So thank you, Kezia. Thank you, Aileen. Thank you, Auntie Charity. Thank you. We have Mrs. Rita. We have Mrs. Rita Kate, Mrs. Rita Ain. We have Elsie Apau. We have Mr. Aaron couldn't join, but he will receive everything via email. Charity. Thank you, Linda. Thank you, Emmanuel. Thank you, Kezia. Thank you all so much. Dr. Nita, Dr. Baafi, Nutritionist Akosua, and then Fitness with Maabena Fitvolution. We are so grateful to you all. We ask that the good Lord will protect us all and safely transport us all into 2022. Abugri, our technical manager, we can't thank you any less. God bless you. God bless each one of us here. Until we meet again with another project, stay blessed. Bye-bye.